right, well, good afternoon, everyone. I'd like to call to order this conference committee on Senate File 4410. And welcome back, everyone. Looking at my background picture, it looks like a nice day. But we'll hope it really is where everyone is this afternoon. So where we left off yesterday when the Senate had the gavel, is we were going through the spreadsheet and kind of going through it a little bit quickly because it is a very, very large spreadsheet. But I think the first order of business today will be to finish that. We were just paused about to start the sections of the spreadsheet that do not pertain to the Department of Human Services. So we have House fiscal staff on the call, or I think we do. And Mr. Harney or Mr. Berg, is which one of you is planning to do the next section?
Chair Liebling, Joe Harney, House Fiscal. I'm going to plan on sharing my screen as, while I do that, as a word of advice to members. Since the spreadsheet itself is a bit lengthy and wide, I would encourage members to either consult a virtual copy in your packets or a physical copy as I walk through, since I'm slightly limited when I present to zoom in any closer than I can right now. So I will be referencing line numbers to assist you to that end. But
well, that's great. Thank you, Mr. Harney. And for those of us who've done this before, members probably have these wonderful special rulers if you have a hard copy, and this can be challenging at the best of times, but we'll do our best. And if let me know if you have questions or need to stop and didn't get a chance to see something. So please proceed, Mr. Harney.
Thank you, Chair Liebling. Members of the conference committee, we are picking up from where Mr. Berg left off on line 1154, beginning the sections related to the Department of Health. The first item listed here is a 988 National Suicide Prevention Lifeline. This is a governor and House position. I will note a slight difference in the structure of the House position is that as it relates to the governor who proposes imposing a 988 surcharge fee on all phone lines in the state, the House position instead converts that funding mechanism to a straight general fund grant appropriation. So to that end, the cost in the House bill to the general fund is $8,671,000 in fiscal year 22-23 and $17,342,000 in fiscal year 24-25. The next item that begins on line 1161 as it has to relate to addressing growing healthcare costs. This is a governor and House position. The position is funded in the House bill to a general fund cost of $2,476,000 a year and $6,114,000 a year in the tails, excuse me. The next item beginning on line 1165 is a Senate only provision. This is the transfer of FASD grants from DHS with a total cost in the tails of $1.5 million for the general fund. Beginning now at the close to the top of page 18 of the PDF is a Senate only position for audiology and speech language pathology interstate compact. This provision has a cost to the general fund in fiscal year 22-23 of $164,000, and in the tails provides $164,000 in savings. Going next to line 1174, the closed loop heat exchanger. This is a Senate only position with a cost in fiscal year 22-23 of $68,000 to the state government special revenue fund, and a cost in the tails to the SGSR of $102,000. Moving next to a 1179 is a governor and House position for assisted living and home care. The cost in the House bill to the state government special revenue fund is $4,167,000 in fiscal year 22-23, and $8,334,000 in fiscal year 24-25. On line 1184 is a proposal for climate resiliency. This proposal has a general fund cost. This is the House and Governor position. This proposal has a general fund cost in the House bill of $1,977,000 in fiscal year 22-23 and $1,977,000 in fiscal year 24-25. On line 1189 is a governor-only position for community healing. On line 1194 is a governor and House position for community health workers. This cost is carried in the House bill to the general fund of $1,462,000 in fiscal year 22-23 and $2,195,000 in the tails. The next provision on line 1199 has a crossover between House File 4099 and a governor's proposal for community solutions. The cost in the House is carried at $10 million in the current biennium and $20 million in the tails to the general fund. On line 1204 is disability as a health equity issue. This is the governor and House proposal that has a cost to the general fund in fiscal year 22-23 of $1,575,000 and of $3,170,000 in the tails. On line 1209 is the reinstatement of the Drinking Water and Wastewater Advisory Council. This does not have a cost carried in the House position, but has a fiscal component. The state government special revenue appropriation for this purpose sunset and expired. Actually, I have that backwards. The appropriation for the Drinking Water and Wastewater Advisory Council never expired, but the basis of it in statute did. So this is just reinstating the council itself and has no state government special revenue cost. On line 1213 is a governor and House position for drug overdose and substance abuse prevention. The cost in the House bill in the current biennium is $5,042,000 to the general fund and a $10,084,000 to the general fund in the tails. On line 1218 is engineering plan review fees. This is a state government special revenue savings revenue increase of $170,000 in 22-23 and $340,000 in 24-25. That's a House and Governor position. There is on line 1222 a funding for families planning special projects. The amount in the House bill in fiscal years 22 and 23 is $3,467,000, and it is $6,934,000 in the tails. On line 1227 is a health provider directory, a governor-only provision. On line 1231, Healthy Beginnings, Healthy Families is a governor and House position. In the House file, the cost to the general fund are $11,700,000 in fiscal years 22-23 and $23,581,000 in fiscal years 24 and 25. Moving to the close to the top of the page 19 on the PDF, there is a governor and House position, slightly different funding for family home visiting. The House position in the bill funds it at a level less than that of the governor's proposal to the tune of $62,386,000 to the general fund in fiscal years 22-23 and $121,772,000 in fiscal years 24 and 25. On line 1246 is a governor and House position for lead service line inventory. The cost in fiscal years 22 and 23 for this inventory is $4,029,000, and in the tails, that cost is $4,169,000. I'm going to pass over the legalizing of adult use cannabis on 1251. This is a governor-only position. Picking up again on line 1266, a governor and House position to fund studies as it relates to long COVID. The amount funded in the House position is $2,669,000 in fiscal years 22-23 and $7,412,000 in fiscal years 24 and 25. Passing over another governor-only position on 1271, there is, I believe on the next page, the House version carried in the House file for this bill, but otherwise this medical cannabis patient fee reduction is as a governor and House-only position. On line 1276 is Medical Education and Research Cost Fund Administration. This is a governor and House position as a net zero general fund cost in both bienniums. On 1281, line 1281, similar to that of the medical cannabis patient fee reduction, there is a similarly situated House position later in the spreadsheet. So I will leave that commentary for that section, but this position is a governor and House only position. Picking up at line 1286, No Surprises Act enforcement, a governor and House position that has an impact to the general fund in fiscal years 22 and 23 of $964,000, and in fiscal years 24-25 of $1,520,000. On line 1290 is funding for opioid overdose prevention and HIV prevention for persons experiencing homelessness. On line 1290, the total cost to the general fund for the governor and House position in the House file is $1,129,000 in fiscal years 22-23 and $2,258,000 in fiscal years 24 and 25. On line 1295, public health system transformation. This is a governor and House position. This has funding to the general fund required of $23,531,000 in fiscal years 22 and 23, and $47,062,000 in fiscal years 24 and 25. On line 1302, bleeding over into the next page here on page 20, is a governor and House position to revitalize healthcare workforce. This is the cost of the Healthcare Access Fund in fiscal years 22 and 23 of $21,575,000. And in 24 and 25, the total cost to the Healthcare Access Fund is $43,150,000. Next is a provision on line 1316 for safety improvements to long-term care facilities. General fund cost of $5.5 million in fiscal years 22 and 23 and $8.2 million in fiscal years 24 and 25. Line 1322 is a governor and House position for funding for school health. The House file funds that at a level of $837,000 in fiscal years 22-23 and $606,749,000 in fiscal years 24-25. Line 1326 is a governor only position. Line 1332 is a governor and House position for trauma system fee adjustment. This has a net general fund cost of $415,000 in 22-23 and $830,000 in 24-25. Beginning now to the section of just House positions, on line 1339 is related to health data collection management. This has a general fund cost of $342,000 in 22-23 and $441,000 in 24-25. Line 1344 is a House-only position for a universal health reform cost-benefit analysis of the University of Minnesota. This will impact the general fund and cost $461,000 in 22-23 and $288,000 in the tails. On line 1349, there is a grants available for lead testing and remediation for schools, childcare settings, and family childcare providers in the state. That has an impact to the general fund of $3,054,000 in 22-23 and $5,080,000 in 24-25. Tied to a similarly tied in the lead proposal is a requirement in the House bill for school-led reporting on the MDH website. That's on line 1354. This will be required to provide funding to the department for $249,000 in 22-23 and $350,000 in 24-25. Line 1359 is the House version of the skin lightening products containing mercury grants. This has an impact to the general fund of $100,000 in 22-23 and $200,000 in the tails. Line 1364 is a mortuary science scope of practice bill that impacts the state government special revenue fund. On line 1369 is the Emmett Lewis Till Victims Recovery Program. Again, another House-only position with a general fund cost of $500,000. That's a one-time appropriation. On line 1374, here you see the House position, the House-only position as it relates to medical cannabis patient enrollment fee modification. This amount carried impacts the state government special revenue fund. Next on 1379 is the Tribal Medical Cannabis Board and Program with a general fund impact of $55,000 in the current biennium and $18,000 in the tails. Line 1384, provider orders for life-sustaining treatment form study post forms. This has a cost to the general fund of $292,000 in fiscal years 22-23. On line 1389 is a bucket of provisions related to mental health professional grant and loan forgiveness. You can see below, on the lines below, how the cost is split out, but the total for this entire package to the general fund is $4,275,000 in fiscal years 22 and 23, and $8,528,000 in the tails. On line 1400 is a House position for funding as it relates to the healthcare professional loan forgiveness program. Pausing here for a moment, the House position expands from a few bills heard in the House, the eligible professions under the current law program, and then expands and provides the base level, a new additional base level of funding for these professionals to have a loan forgiveness pool available for $22 million in fiscal years 22-23 and $44 million in 24-25. Line 1405 is has two prongs to it. One, it modifies in the House file the a level at which there's an elevated blood level in children, but also then provides funding, as you can see on line 1408, to local public health organizations based on the increase in that need to respond based on the change in the blood lead level. That cost has to the general fund $16,172,000 in 22-23 and $10 million in the tails. Line 1410 is funding for the Palliative Care Advisory Council to the general fund. The cost is $44,000 in 22-23, $88,000 in the tails. Line 1414 is cost at the Department of Health to support the work of the Healthcare Affordability Board. Again, another House-only position. This costs $2,506,000 in fiscal years 22-23, and it costs $5,447,000 in the tails. Line 1419 is the expansion of the amount of medical cannabis manufacturers in the state, moving from, I believe, 2 to 4. Someone can surely correct me if I'm wrong. This has a state government special revenue savings in the current biennium and the next as it relates to the licensing revenue projected on the expansion of manufacturers. Line 1424 is the House-only position for nurse staffing and loan forgiveness. This is tracking the cost of the loan forgiveness and the maintenance of, I believe, the reporting required in the bill. The total is in the current biennium, $9,542,000 and $19,092,000 to the general fund in the tails. Line 1430 is a one-time appropriation in the House bill for antigen testing and KN95 masks. Again, one-time appropriation from the general fund for $15 million. And then lastly, on page 21 here is a one-time transfer from the general fund in the House file to the public health response contingency account in fiscal years 23. Wrapping up the Department of Health here, there is funding set aside on line 1441 for the administration of grants as it relates to the replacement of lead service lines, $5 million in 22-23. On line 1446, local and tribal public health and other house only position, $9.9 million in 22-23, $19.8 million in 24-25. Line 1451 is $50,000 a year for the Dignity in Pregnancy Act. And line 1456 is the cost at the department in the House Preventing Homelessness Division report for Safe Harbor grants. Madam Chair, it might be worth pausing before we go to the health related licensing boards next to see if members have any questions.
All right. Thank you very much, Mr. Harney. It's a lot to take in. I know members are nervous about the quiz. Of course, we never have a quiz. We've always got our documents to look at. And Senator Hoffman, do you have a question? Please go ahead.
Thank you, Madam Chair. Is this thing working? A quick question. When you're looking at the spreadsheets that were in front of us, I noted there were some public health provisions that might have the jurisdictional value within Title V programs that the Department of Health would do. Do you know if you factored into this budget those matching dollars in specifically Title V? When I look at lines 1231 and then just on the last sheet 215, forget the number, but were those factored into those dollar amounts? Did you do a collaborative effort with Title V, which you do have a public health plan in the state of Minnesota? Question.
So that might be a good question for Mr. Harney or the commissioner, but I don't think so. But Mr. Harney, can you respond to that?
Madam Chair, Senator Hoffman, I can't. So I would like to punt that to the department or another friend on the line.
Okay, is there a fiscal staff from the Department of Health that could respond to that? All right, I'm not seeing anybody right now, Senator Hoffman, so I think we'll have to get back with you on that.
And Madam Chair, if I may, maybe as a follow-up, one of the things, if you look at the Department of Health and actually the Department of Health and Human Services, they have to do a Title V public health response and a grant, and it's available for folks to see, and there's some health indicators that are mentioned in there, perinatal, prenatal. Mr. Harvey is raving. So these activities fit within the guidelines of those Title V, and I guess the deeper question is, if we're looking at creating a new system, are we indeed creating a new system, or are we actually looking at the collaborative effort that must occur when the feds say, Minnesota, here's $11 million, use that as a match to whatever is coming. And that's, I guess, maybe if they could just follow up and give that a thought and get an answer to us back, and I'll let you keep going, Madam Chair. Thank you for that.
Great, thank you, Senator Hoffman. And, you know, I know in the lead area, coordinating, as you know, there's a lot of lead prevention items in our bill, and there is an effort there, I know, to coordinate with federal funds that are for that purpose. But on this one, I just don't know. But thank you. Okay, other questions before we go on and finish with the spreadsheet? I don't think we don't have a lot left, and hopefully we can go through this next piece very quickly. All right, not seeing anything. So Mr. Harney, why don't you go ahead and finish up?
Yeah, sure. Thank you, Madam Chair. I would like to, before getting into the next section, make a clarification that there are two Senate-only provisions that are not printed on this version of the spreadsheet for the Board of Nursing and the Board of Behavioral Health. So if the committee would wish to consider those, I would hopefully ask Mr. Albrecht to help me out after the presentation to provide those Senate positions. But beginning with the health-related licensing boards for the Board of Dentistry, line 1474, again, a minor state government special revenue cost needed for to acknowledge some appropriations. Line 1480, the Board of Dietetics and Nutritional Practice. This is a operational increase, SGSR revenue for 25,000 in 22-23 and 50,000 in the tails. Line 1533, excuse me, the Board of Pharmacy. I'm 99% sure, Madam Chair, that the numbers you see for the governor here are miscopied from the Board of Dietetics and Nutritional Practice proposal. So you can probably ignore those. I'll confirm with Mr. Berg and Mr. Albrecht later, but there is one House position included in here and another Senate position. The House is providing $175,000 for the purposes in fiscal years 22 and each year thereafter for the board as it relates to contract with a pharmacist, and the Senate has a medical gas fee reduction tracked for $235,000 in fiscal years 22-23, and then each fiscal year thereafter. On line 1541, this is the administration of the Healthcare Affordability Board, House only position. The numbers provided before was the technical assistance that the House position asked the department to provide, but as a standalone board, these are the costs therein. $1,070,000 in fiscal years 22 and 23 from the general fund, and $2,902,000 in fiscal years 24 and 25. We have a bucket here of other health and human services agencies beginning on line 1547. An operational adjustment for the Council on Disability is a governor and House position. That is $375,000 in fiscal years 22-23 and $750,000 in fiscal years 24-25. On line 1553 is a House only position for the one-time space and rent cost defrayment at the Emergency Medical Services Regulatory Board. And on line 1555 is a House only position for the Ombudsman for Mental Health and Developmental Disabilities that has a general fund cost of $189,000 in 22-23 and $422,000 in 24-25. The last set of agencies here are non-HHS or health-related licensing boards that are in the House position, with the exception of MNsure. So let me just cover the Commissioner of Commerce first here. House only position that bleeds over onto the next page for the Prescription Drug Act costs and the, excuse me, this is not, yeah, it's the Prescription Drug Act costs at the Commission, at the Department of Commerce, and the ectodermal dysplasia insurance cost defrayal. The cost to the Commissioner of Commerce funded here in total $251,000 in 22-23 and $836,000 in the tails. MNsure here is carried a couple of positions that the governor and the House have. The House position funds the technology modernization at in fiscal years 22-23 of $7,775,000 to the general fund and $10,997,000 on line 1580. There is also cost at MNsure in the tails funded here as it relates to the public option proposal that I believe Mr. Berg walked through yesterday. Those costs respectively look to be $10,982,000, $3,506,000, $6,450,000, and 2 million. I believe I'm totally them wrong. Excuse me. That is the cost for the IT development is $3,506,000, and the revenue loss costs that are tracked is $2,929,000. Excuse me. Rounding out here, the Commissioner of Labor and Industry has costs in the House bill for the Nursing Home Workforce Standards Board. That is $641,000 in 22-23 and $690,000 in 24 and 25. The AG has two one-time appropriations in the House file for expert investigator and witness costs and Prescription Drug Act costs. These two total in fiscal years 23, $456,000. MMB Minute both have costs for the early education data sharing project. The costs at MMB are $492,000 in 22-23 and $289,000 in 24-25. The cost for early ed data sharing at Minute in the House file is $6,441,000 in 22-23. The Commissioner of Employment and Economic Development will receive funding in the House file for a child care workforce study, one-time appropriation, $255,000. The Commissioner of Education has costs as it relates to the early education data sharing project to the general fund to the tune of $264,000 in the current biennium and $996,000 in the tails. And lastly, we have a Senate-only position for Professional Educator Licensing Standards Board. And the net of the Senate position results in a general fund cost of $25,000 in the current biennium. Madam Chair, that's it for the spreadsheet.
All right, thank you, Mr. Harney. Senator Abler.
Well, thank you, and I appreciate the walkthrough, and I appreciate all the work that goes into this. And Mr. Harney, I want to welcome you aboard to this amazing topic area. The needs that we contend with are just profound, and I do think you have a future in broadcasting. I think that was pretty amazing to do all that. Representative Liebling, just some observations. I noticed on the Department of Health that your spending is about $746 million, and ours is somewhat less at $1.7 million. But I do want to point out there is an area of commonality. That is in the Board of Pharmacy. And even though the numbers vary and probably the policy, we all agree we should give them a little bit of money to do whatever it is they're going to do. So I think we can build on that. So I'm pretty optimistic. And rather than go into any detail on any of the questions, I just, and Representative Liebling, you can defer the answer if you like, but I think the question we'll have to sort of figure out coming forward here. We've had some good conversations privately, but I guess the question that's on my mind, and again, don't feel like you have to answer it now, but if the House had $1 billion, I'm curious what they would buy with that, with their priorities, and perhaps some of those are coming today. But is there anything you want to comment on, Representative Liebling?
Well, thanks, Senator Abler. And first of all, Mr. Harney, I wonder if you could stop sharing there we go. Okay, that's great, thank you. So I think, Senator Abler, we have a broader view of what the critical needs are for the state than the Senate's bill shows. There are lots and lots of needs, and the plan now for today, the next plan is to go to Chair Pinto and let him talk about the needs that he sees in the childcare area. But I think there's no question that we have a lot of needs across the state. We talked about this yesterday, and it's really a matter of where you think the needs are. And I think today, and I'll be talking a little bit later kind of about these first two articles of the bill, and we're going to hear from Commissioner Malcolm from her, a lot of these items in these two articles are from the Department of Health, and some of them are additional, or we've worked with some of those items and they're House items. But this is even today is just a part of the picture, because there are a lot of needs across the state. I don't know that I can tell you in 2 minutes, how I would spend $1 billion, but I think we've got a lot of it right here on the spreadsheet. And I hope that we will have some areas of commonality and not just things that the Senate has on your spreadsheet, because you just didn't cover as much ground as we did. I think that's pretty clear. And, you know, Minnesotans, for example, well, one big area, and you know, I'm quite disappointed that in our spreadsheet, we're continuing the process of getting rid of that spend down that I think you and I agree is so discriminatory against people with disabilities to be able to get onto medical assistance. And we do have that in our spreadsheet, and that's something that I'm really disappointed that, you know, was not able to be fit into your budget, even though I know you and I agree on the topic. I mean, there are lots of items, really too many. You don't have anything on maternal and child health. We feel that right now, I'm kind of preempting my speech a little bit for later, but we kind of feel like we need to make sure that every child who comes into this world in this state has the best possible chance to grow up healthy and you know, reach the top of their abilities. And we need to focus more on maternal and child health to get that done. We've got an increasingly diverse state, and it's going to be, as you know, the younger generation is more diverse than the older generation, but our future is making sure that every single person, regardless of their background, can be at the top of their game. And so we need to make some really broad-based kinds of investments to be able to do that. So I'll stop there because I'm really getting off track. You know, I could talk about this for a long time. I know you could too, and probably every member of this conference committee could, but I'm gonna, so back to you, Senator Abler.
Well, and just briefly, and I just was sincerely asking the question because I have a feeling, I don't know, call me prescient, but I'm not sure that our target's going to be close to $3 billion when the dust settles. So I appreciate I appreciate the agreement on the Board of Pharmacy. I think that we can take that as the takeaway on this, Madam Chair, and I'm looking forward to the rest of your presentation. Thank you very much.
Well, thank you, Senator Abler. I just have to say on that one that I think our two views, just for the public here, there's very different ideas that are reflected in those different sets of numbers. So, but I hope some of them are ones that we can agree on. Certainly in ours, you know, we have the repository that we set up, the repository for medications, and we all agreed on that, and it's doing great, but it needs some, you know, if this is a service we want to buy for the state, and I think it is, our bill says we better invest in it so the department can actually, Board of Pharmacy can contract with that organization to get these services for the state and have it be an ongoing. So there's one thing. I think it's a little different, but we'll get into that. So I'm going to go now to Chair Pinto and give him the opportunity to talk about the items that his committee has in the bill. And Chair Pinto, I'm going to turn the floor over to you.
Okay, thank you, Madam Chair. I'm speaking of people who can go off for a long time about stuff that they're passionate about, so I'll try to restrain myself. And members, speaking of which, so my plan here is to get into some of the details in the spreadsheet and in the articles, mostly the spreadsheet. Before I do, I hope you'll indulge. I think it'll be helpful to just set a little bit of a big picture before we get into that. I chair the Early Childhood Committee in the House, and I know there's not a comparable committee in the Senate. It's unusual because part of our jurisdiction flows to HHS and part flows to education. You have heard members in both the House and the Senate. You've heard Commissioner Harpstead refer to the caring professions. Childcare is one of those caring professions, and I think it's important to note that even in my questions yesterday, talking about long-term care and nursing homes and PCAs and childcare workers, all these folks are ensuring that people in our state can live in dignity and providing caring for people in our state. It's so critical. And childcare is something else as well. Members, I think you may have heard this from Commissioner Harpstead, which is the childcare is the workforce behind the workforce. So the people who are doing our work in those other settings are people who are, many of whom are dependent on childcare, and the people who bag our groceries and the people who take care of our society. And we kind of saw this in the first weeks in the pandemic, that we needed childcare to be in place so that people could take care of all of our other needs, health and otherwise. And childcare is also the workforce behind our future workforce. this is early learning, and the opportunity gaps that we see in our state start in these very early years. For every one of us, that first year of life was the most important. We don't necessarily remember that, but it was. So I want to really emphasize to you the importance of this area and in fact, to use Senator Abler's phrase, the critical urgency of this area. This is a sector that was broken well before the pandemic. It is continued to be held together with duct tape. The name of that duct tape is stabilization payments. There have been these monthly payments that have been going out, and the reason you have not seen a collapse of early care and learning in our state is because of the efforts that have been made in these last couple of years. Families are paying huge amounts for childcare, and I want to make sure we're really clear that what's happening here is this is not a choice families are making. In many cases, they say, well, I could have childcare, I might not. They need to pay the rent. They need to be able to pay for food. And the choice is paying for childcare, or potentially they have a child, their child be maybe the neighbor down the hall or the new boyfriend, because that's what they can afford, which has real concerns for child development. The people who do this work receive poverty wages. My question to Senator Abler yesterday about the wage level in some of the other areas we're funding. Childcare workers, I looked into this, receive lower wages than many of the areas that we're talking about funding, and in fact have higher education required to do the job. And again, this is not to criticize any other area. We need the people who give dignity for people in our state, who are all the areas that we're funding in HHS. They all need to be lifted up. And it's important to note that when you talk about critical urgency, this is a sector whose workers are receiving even less to do what is this critical work for society of not only having parents work, but they're doing teaching so that kids are set up so they can take care of all of us in future years. And our businesses are calling for this. This is the biggest workforce development challenge, according to a number of our businesses throughout our state and chambers of commerce, Coalition of Greater Minnesota Cities, childcare biggest workforce development challenge. So it's this rare area in HHS where rather than being sort of about one thing or fulfilling our moral obligations, helping people live with dignity, this is about helping us right now to do all the other things that we want to do, and is absolutely urgent. I'm going to dive into the spreadsheet and the articles, and it shouldn't take too long to be walking through that. I'm just going to pause to see if there are any, Madam Chair, any questions or anything about what I have said so far about any of that. I doubt that there is, but just on the chance. And I'm not seeing anything,
All
so I
right.
will continue.
Thank you, Chair Pinto. And I know you're probably going to do this, but if you would just tell us as you proceed here what document you're working on, so we can.
I certainly will. Yeah. So members, and Madam Chair, I'm going to just pull up the spreadsheet. I think that's going to be the easiest thing. That's maybe the word easiest and spreadsheet maybe are not always, and HHS spreadsheets not always in the same sentence, but we'll give it a try. So if members can go to page 2 of the spreadsheet and line 135. And I'm going to try to not get too deep into it, but I think it can be useful for us to have this in mind. Line 135 and several subsequent lines that I'll point out relate to the Child Care Assistance Program. This is a program that is more important in Greater Minnesota even than it is in the Metro. It's a program that allows our employers to expand and our communities to thrive, and of course for parents to work. Our rates in that program, as members of this committee are well aware, have been extremely low. We were able to raise them a little bit last year. We are still in, I think it's the bottom 6 or 7 states in terms of our rates. The federal standard to allow families to actually have the access to the care that they need, and we're talking about really low-income families, to remind you, would be the 75th percentile. And what we fund starting at 135 and beyond is to increase rates to the 75th percentile, which is the federal standard. Specifically at 135, you'll see that it says change in Child Care Assistance Program definition of family. We want to make sure that those families that are particularly vulnerable are taken care of by this program. We're talking about foster parents, guardians, and custodians. Kids in those families, we especially have concern that they be supported. And line 135 expands the definition of family for purposes of the program to allow that. If you flip members down to line 193 on page 3, CCAP maximum rate update, that's what I was just referring to, of getting the rates up to that 75th percentile. so that kids can have and families and providers can have make sure we have the quality that they need. Again, for the benefit of all of us, I just want to make sure if all you care about is selfishly taking care of yourself, you want the person who's taking care of you when you're in a nursing home in future decades to have had a high quality early experience. That's what this helps to do. You look down on line 206, several lines down on page 3, it says make childcare reprioritization permanent. Members, the basic sliding fee under CCAP is something that is simply a block of cash that we hand out. If that money runs out, that's where we get waiting lists for childcare and families that are then on the outs. What reprioritization does is shift certain families to be on the MFIT program where it's forecasted, and we can make sure that we are reducing those waiting lists for those very low income families. Our proposal funds that at line 206. Continuing on to line 221 on the next page, page 4, you'll see that it says childcare stabilization and supports. There are grants at line 223 that are for childcare programs experiencing extreme financial hardship. This was proposed by the administration, and the House is thinking that this is a very good idea as well. The last thing we need is to be losing more of our critical childcare providers, both family and childcare centers. Beginning at line 225 to 229 are a series of proposals, many of which came out of our Family Child Care Task Force to support those family child care providers that are the backbone of our system, especially in Greater Minnesota. We provide line 225 one-stop child care assistance so that they can go to one place and receive the help that they need, regulatory, resource, and otherwise. There are workforce development grants on the next line, shared services alliances. If you're a small business owner on your own as a family child care provider, boy, it can be helpful to you to combine forces with others for some of the back-end services you may need. The Family Child Care Task Force, chaired by Senator Kiffmeyer and Representative Wozniak, recommended that. We want to make sure to move forward with that. And grants to support technology as well on line 229. So it's lines 225, or pardon me, maybe that's 226 to 229. It's hard to see in this spreadsheet, for me at least. Line 234 are child care stabilization grants. I referenced this before. So when the pandemic hit, ours was the first state to put in monthly supports for providers. This is why you have not been hearing about a collapse of childcare in each of your districts where it's so critical. Those grants are scheduled to decline starting at the end of this fiscal year and to be eliminated altogether at the end of the fiscal year. I'm anticipating that we are going to be seeing some real negative impact on the sector and then spreading out to other sectors. If you're worried about workforce shortages right now, they are really going to be kicking in fast as childcare providers are closing and not receiving the support. We need to recognize that this is a public good. All the reasons I said at the start of this. And in the House's view, a public good needs ongoing public investment. That's true for learning and care when children turn 5, whatever form of support you believe that should be provided. And we have a lot of discussion about that in K-12 education. That's fine. We need to recognize that that's no less true for younger kids. In fact, it's even more important when we know the science of brain development. So that's at line 234. Line 240, family, friend, and neighbors. Many of our children, a significant portion, are cared for not in licensed child care settings, but they are cared for by an auntie, by a grandma, by a neighbor who cares for a number of kids. We want to make sure to provide support for those caregivers as well, so that they can make sure that they're providing enriching experience for kids. So there are grants. We had funded some of this in the most recent budget. It's gone extremely well. We want to continue to do that in line 240. Line 249, there's an ombudsperson for family child care. Again, a recommendation from that task force. The funding for that position is scheduled to run out in a couple of years. It's currently funded through federal funding. We want to make sure that continues. And so we have funding for that. That's in the final year of the 3 years. Line 253, retain brain builders. We know that for the youngest children, for infants and toddlers, a long connection with a caregiver is absolutely critical. Now, listen, we want that to be apparent if it possibly can be. The reality is for our families, many of our families, they have got to go to work to be able to pay for the food or pay for the shelter that their kid needs in the first place. So when that is the case, we want to make sure that there's a longer term relationship to be in place in child care programs, instead of having a cycling through. Somebody might be with a kid for a week and they move on because the wages are so low. So this Brain Builders program, it's a pilot, is to make sure that if somebody is in the profession for a period of time and developing a relationship with the kid, that they can, with children, that they can stay in that role for an extended period of time and continue to develop that relationship and that support. The next line, 257, to develop a child care cost estimation model. Right now, you'll note that our child care assistance program, the rates are based on a market survey. When I said the 75th percentile, well, those the market rate is a rate that is actually quite low compared with the cost of actually delivering care. We want to make sure that we're paying for the cost of providing high quality experiences for kids. Again, because that is a benefit for all the rest of us. What this is to develop a cost model to just understand what is the actual cost of giving child care to kids in these different settings, and high quality childcare, right? We want to make sure the kids are receiving an enriching set of experiences. So that's what that line 257 is about. Line 265, IT and data exchange. We have an extremely fragmented system. I could, for early care and learning, I could name off right now 8 different programs that are subsidizing childcare and early learning all across and in a really fragmented way. We've got to have them working better together and communicating better. This comes out of a Office of Legislative Auditor report from 2018. And it's something that I've been working on, and many others, and sort of good governance folks in early childhood have strongly recommended that this is an important next step to make sure the programs are talking to one another, communicating with one another, and coordinating with one another as well. This is a program that goes across a couple different agencies. You'll see a small amount here, but there's be more at the end of the spreadsheet. Next, line 273, school-based mental health grants. This is a proposal from the administration that authorizes DHS to make grants to school districts and charter schools to provide early childhood mental health services, not only to kids, but also to their families as well. You'll recall that I think any of us who has kids, probably the most stressful time of your life is when your kids are really little, and to provide support for those families is really, really important. Members, we're now jumping to, well, I guess I'll just note on line 726, page 11, there is a net interaction of a series of program, of childcare program changes. Again, page 11, line 726. I'll just note that that's something that is in our area. And hold on. And then flipping towards right the very end of the spreadsheet, if you go to page 23, the last couple of sections, these relate as well to the data sharing that I just mentioned across a couple of different agencies. So again, page 23, you'll see lines 1593, line 1598, line 1602, actually, pardon me, line 1607. Those three say Early Ed Data Sharing Project. You'll see there in MMB, Indeed, and MDE. This shows how this IT and data sharing really links into multiple agencies. We've got to have them talking together so we make sure that our early childhood programs are working just as effectively as they can. The final spreadsheet item that I'll note is on that same page, page 23, line 1602. There's a child care workforce study. We do not have, when I talked about the wages for childcare workers, that's the best information we have. But the fact is we have pretty lousy information because it is such a fragmented, complicated, and oddly, although it's heavily regulated in some ways, it's very much not overseen so much in others. So there's just all these different pieces. We need to just understand this workforce and what's going on with them. And so we have a small amount for DEED to conduct a study of the child care workforce. Madam Chair, there are a few items in articles that I'll highlight, but I think maybe I'll pause. I'm talking for a heck of a long time, and just see if there are questions about things I've said so far. And again, I see.
All right, Senator
I do see
Abeler.
one.
Well, and just brief, and I appreciate, and Representative Pinto, Appreciate your passion on this, and we've talked about it a lot over the last couple of years, and you see you put a lot of thought and energy into a lot of this. Just on the math question, do you know, I didn't think to add them up as you're going along. You've spent a considerable amount of money, and the governor does as well. I think you're a little below his number, but do you have an idea what the total is on all of your, I don't need it right now, but just it'd be interesting to see where, as I look at your priorities and what they might amount to.
Yeah, Representative Pinto, I bet you do know the answer to that.
Well, what's funny is, Madam Chair and Senator Abler, thank you so much for the question. I will admit that right at the moment, so my committee received a target, but then got split into different pieces. And as I'm sitting here, I'm trying to recall, I certainly know what my target was, but it went into the ed area as well. As I'm sitting here, I'm blanking a little bit. So maybe the safest thing is to get back to Senator
Well, that's fine.
Abler. Yeah, but that's a great question, Senator. Thank you.
Yeah, no, thank you very much.
Unless one of our fiscal staff in the meantime can answer or can work on getting the answer.
Madam Chair,
Bert,
this is Doug Berg. The early childhood bill that came out of Representative Pinto's committee, the HHS portions of that bill spent, all of which are in this bill, spent net general fund dollars of $79,575,000 in fiscal 23 and $474,572,000 in 24-25. And in addition, there is an expenditure of $47 million in the tails of TANF funds and $68.5 million of federal CCAP money in 23 and $6,800,000 of CCAP funding in 24.
okay.
Thank you very much.
Thank you. Thank you, Mr. Berg. Okay, Senator Benson.
Thank you, Madam Chair and Representative Pinto. The child care stabilization grants, are those ongoing? Because I know we did some stabilization, but is it your belief that this crisis is going on into the foreseeable future outside this budget window?
Chair Pinto.
Thank you, Madam Chair, and thank you, Senator Benson. Yeah, that essentially the short answer is yes. I guess essentially that we made an error a long time ago in saying that development and learning starts at age 5, and that's when we're going to have ongoing public support. And instead, we recognize that by not doing that, we've set ourselves up for a lot of problems now. And so, in fact, it is time to step in and have ongoing public support for this public good. Correct.
Senator Benson.
And Madam Chair, Representative Pinto, the IT data exchange funding, and perhaps council can help me find it. I was looking for the language referral there.
You're looking
Agreed.
for the bill language, Senator?
Yes.
I wonder, yeah, I think, Madam Chair and Senator Benson, I think it's in Article 21, right at the end of Article 21, I believe, Section 16. But Ms. Mock can correct me if I'm getting that wrong.
Thank you, Madam Chair and Representative Pinto. So we have policy about school data sharing. Will this mirror that? And I'll look more closely at the language. I just want to get some understanding of where you started as you were looking at data sharing.
Yeah, thank you. Thank you, Madam Chair. Thank you, Senator Benson, so much for asking about it, because, yeah, this is a particular passion of mine, I will say. To be clear, we're really just talking about state agencies sharing data with one another. So it's not sharing data outside of state agencies. And the issue, just to back up a little bit, we funded in last year's budget, we funded together a study of governance in early childhood. So MMB did a big analysis looking all over the country at different options for governance, recognizing that, again, as the OLA had said several years ago, this is a mess, this area. It really is a mess. One of the pieces that came out of that was to say a particular mess is the IT portion and the data sharing. I guess it's not just IT, to a certain extent, it's even what are the rules allowing, if a child's funded through CCAP, and funded through learning scholarships. By the way, the same child could be, just having a coordination between the two. How do things work? So that was a need that came out of that. And this is then attempting to address that need. I hope that that's helpful, Senator.
Thank you. And
Yeah, and we-
Madam Chair, Representative Pinto,
Senator
last
Benson.
question on the IT. So is this early ed data sharing project, there's a lot of DHS IT being built. Does this fit into DHS IT build, or is this going to insert itself early in that build process?
Representative Pinto?
Thank you, Madam Chair, and thank you, Senator Benson. This would, I think, connect to that, but it is kind of different because it's programs that are at DHS, but also at MDE and potentially MDH and DEED communicating with one another. So there would be a connection to other DHS IT work if that's what you're referencing, but I think it's a little bit separate.
Thank you.
Yeah.
And
Thank you.
Annie Mock is on, I think, if we want to get, if she wants to confirm where these items can be found in the bill. Ms. Mock?
Yes, thank you, Madam Chair. Yes, Annie Mock with House Research, and Representative Pinto was right. It's in Article 21, Section 16. That's the direction to minute for the IT study.
Okay, very good. Thank you. Thank you. Okay, so Representative
dive into
Pinto,
the-
anything you want to conclude with here?
I was just gonna note about the articles, and I think this can be pretty quick. I'll just note, so there's a provision in Article 10, Section 10 regarding those mental health grants that I referenced. But otherwise, all the early childhood portions are really, or the portions relating to childcare and early learning in particular, are in two articles. One is Article 19, which, one moment, which is about DHS licensure. There are a number of proposals, a number of provisions there, and I won't walk through them, but I do want to highlight one item that's really important in that. It's Article 19, Section 27. And it would allow DHS to administer pilot programs relating to the modernization of childcare regulations. And I want to highlight this just because we've heard comments about concerns about childcare regulations, which I would agree. There's some significant concerns there. Last year, we funded an effort to modernize those regulations. They've been in place since the 1980s. That effort cannot move forward unless that language is important. There's no cost to it. So I just want to highlight for members, it's in the House bill, Article 19, Section 27, that I would sure hope we could just move that forward so we can make sure to get our childcare regulations improved. Otherwise, there are a number of provisions there that we'll be able to walk through, I'm sure, in Article 19. And then in Article 21, this is specifically the childcare policy article, and most of these items are reflective of what I walked through in the spreadsheet. I'm just looking to see if there's anything in particular to highlight for you, but I think that the summary that I provided in the spreadsheet does that pretty well. Certainly happy to talk about any of the details, but I want to be respectful of folks' time. I do have one concluding point, Madam Chair, but maybe I'll just say, make that, and then we'll see where we go from there, which is you all would have received in your electronic packet. I'm hopeful those of you in the room received a physical copy as well of a letter that kind of reinforces the points I made at the beginning about how critical early care and learning is, pointing out about parents' struggles to access and afford care, the poverty wages to people doing this work, and really calling on us to make significant investments in this area. And it's an unusual set of signers. The first two signers are actually from Anoka County, Senator Abler, your county attorney, and your sheriff. And this is a letter headlined, "Fight Crime, Invest in Kids." So if the fact that childcare is one of the caring professions and is the workforce behind today's workforce and is the workforce behind the future workforce, if those three reasons are not an argument to you to say we should be heavily prioritizing early care and learning, then maybe the chiefs and police chiefs and prosecutors who are calling us to invest in order to fight crime, hopefully that would make the case as well. So this is absolutely critical, and I really appreciate the attention you've given, and we'll be eager to continue to discuss this along the way. But this is, I'll just say, it is the police chiefs and prosecutors, the letter could pretty much say critically urgent at the top: fight crime, invest in kids. So let's do it. Thank you so much, Madam Chair and members.
All right, thank you, Representative Pinto. And Senator Abler, did you have your hand up?
Yeah, thanks. I'll talk to Jim and Tony and see what they, that'd be interesting. Yeah, Hoffman and I will have that meeting. So Representative Pinto, thank you. You just kind of flew by a couple policy only sections, and I don't want you to repeat them now, but if you can just make sure we have those to look at. It seems like we're really off on a good start to try to find ways to cooperate, at least where it's, not difficult to start with. And so I'm interested to see what's important to you and what we can consider. So thank you very much.
Thank you, Senator Abler. And any final word there, Representative Pinto?
Well, I'll just note, Madam Chair, thank you, Senator Abler. I didn't necessarily want to sort of do section by section, respecting folks' time, but of course, I'm delighted to talk about this stuff anytime, anywhere, as you well know. So yeah, I'll be eager to do that. I did want to highlight that one policy provision that is especially important to make sure we get those pilot programs, because we need to make sure childcare regulations can be, put in really good shape. But yeah, happy to walk through those at any time. And thank you so much for the question and the interest.
Right, and we considered giving Representative Pinto the entire time, but we thought maybe that wasn't the best use of our time.
Madam Chair.
Senator Abler.
That was very merciful. Thank you. And yesterday we went through some of the Senate-only policy things, and there are some things that are, kind of important. Some things are just kind of, not that big a deal. But it's helpful for me to know, Senator Representative Pinto, like which ones of those are particularly meaningful. We can just consider those, and some of the bland stuff as well. Thanks. So I'd like a list of all those, not just the two you mentioned or whatever. Thank you.
Yes, thank you. And just a note that staff told me that the letter that was mentioned by Representative Pinto is document 48 that was sent out. Sent out quite a few documents, but that one, if anyone cares to go and look for it, and having them numbered is very helpful, helps you find stuff. So thank you, Mr. McClellan. Okay, so we will move on. Thank you very much, Representative Pinto. Every time I hear you talk about this, I learn a lot. And I thought that was really helpful because, I don't sit on that committee, and I'm really grateful that you're taking on that work and that you do have that great passion, because I do join you in really thinking that it is a very, very critical, important area for the state. So next I'd like to go to Chair Gomez to talk about the provisions in the bill that come from her committee, her division of the Human Services Committee, the Homelessness Division. Chair Gomez.
Thank you so much, Madam Chair. Pleased to be able to share some of the work that our division did this year with the conferees today. I'm really glad that we started our work together yesterday by talking about critically urgent needs in the state of Minnesota. And I actually think that Representative Albright has a really beautiful way of talking about these issues, not just because of his excellent radio speaking voice either, but he talks about our obligation to take care of people at the dawn of life, our babies and our kids, at the twilight of life, our seniors, our elders, and in the shadows of life. I think that I also heard, in Senator Curran's comments yesterday, really sort of reflected that. And so, in this space, in this committee where we have a lot of differences, I think that we can agree on those things. That we're here to help out people in our communities who need a hand. The area of preventing homelessness, I sometimes think of it as like the tip of the spear. It is this visible kind of manifestation of the places where we're not doing well enough by our people. And it's a complicated area, and I'm definitely still learning a lot along with my committee members. But this is a place. These are people who need our help, and this is a place where we can make impact. Every year, 50,000 Minnesotans experience homelessness, and on any given night, there are 20,000 people across our state, in every region of our state, who don't have a place to lay their heads. And our investments in preventing homelessness, which you will find mostly in Article 18 of the bill, really acknowledge the severity and depth of this crisis and are realistic about what it will take to meet this moment in a way that serves those in our communities that need help from us. You know, the approach across our budget, and especially in this area, says something really, really simple to our people. In a time when we have a $9.5 billion surplus, it is not right for us. We will not accept people sleeping in the streets. We will not accept it. And that's a choice that we get to make. We're not going to stand by and let people in our communities, our people, our neighbors, and our family fall through the cracks of a system that isn't working. You know, there was a lot of focus yesterday on you know, long-term care and nursing facilities. And in our state, elders 55 and up are actually the fastest growing segment of the homelessness population, or the homeless population. Our point, you know, most of the data comes from the point in time count, which we haven't done consistently because of COVID, but from 2015 to 2018, homelessness among elders was up 25%, when for all ages it was up 8%. So there's this disproportionality. And I guess I just would say, like, we have to care for all elders, whether they have access to long-term care facilities or whether they don't have a place to stay at night. We can't say, oh, you know, these people are worthy and these people aren't worthy. So, you know, in my opinion, it's like again, this sort of reveals these fault lines in our society, and it reveals, you know, a growing homelessness population reveals a society whose systems aren't meeting the needs of its people. And what I've found in homelessness is that what basically has emerged is a system that was cobbled together, that was the result of responding to acute crisis and then saying, okay, well, then I guess that piece is still in place. It's not that we have, I think this is true probably across a lot of systems, but it's not that we were like, okay, here's the issue, here's the budget, and we're gonna like spend the budget in the most rational and useful way to address the issue. There is major kind of fractures and difference in the services that you have access to, depending on where you live and depending on your demographics. So just to start out with, I mean, I don't want to walk through the spreadsheet altogether. These items start on line 928, but I did want to just lift up a few of the centerpieces of the work that we are doing here. So I'm gonna share a map quick. Let's see, and I think that Patrick sent this out to folks.
Yeah, you should, members should have this, and this should be available to the public now as well, I think. So late-breaking piece of, late-breaking document.
Yeah, sorry to send it out late to everybody, but so this is a map that shows the number of emergency shelters by county in across our state. And you'll see that Hennepin and Ramsey have comparatively a lot of shelters. St. Louis County has some shelter, but even Olmsted County does not have adequate shelter to meet the needs in their area. And in 80 of 87 counties, there is inadequate emergency shelter response. So what you have is people in these communities, in your communities, cobbling together, you know, philanthropic resources and donations from a church and getting people into, you know, hotels maybe, or like really kind of trying to knit something together, because we don't have a response for them, because there is no shelter in most of the state of Minnesota when you look at the geography. So, you know, I hear from folks all over the state, as you can imagine. If you have a kid in Northfield who's 16 to 24 who shouldn't be in adult shelter, you have to send them up to the southern suburbs. It's an hour and a half away. you know, folks in up in the Bemidji area, there's a huge homelessness issue there. I mean, they're again, they're putting together kind of like funding for hotels and various things. So, you know, the Minnesota Coalition for the Homeless has done an analysis, and there is the need for $115 million of shelter capital investments across the state. We have 75 million in our budget. It will build about over 1,500 units, new units of shelter, and this is the time to do it. This is the time to do it. If we can get this piece over the line, right? If we can get this shelter capital piece over the line, we can really address the issues that are not only facing like the people who are out in greater Minnesota who find themselves without access to housing that's affordable for them, but also some of the issues that are facing those of us in the urban core. We heard in our committee, in Hennepin, 40% of those that they serve are from outside of the county, and in Ramsey, it's almost 60%. So what we have is our three biggest counties, Hennepin, Ramsey, and St. Louis, dealing with this issue for the entire state of Minnesota. If you're a family and you lose access to housing in your home community, and a lot of people make the decision to drive across the state, away from their family, away from their friends, away from their, you know, faith community, away from their kids' schools, because they have no other choice. They have no other choice. And so this is a, you know, I think like a lot of these things, this has been a long-standing issue, and we have the chance this year to really make a difference and to really make a dent. And so that's sort of the first two items starting on line 928 are the emergency shelter investment. And then along with that, emergency services programs, which Senator Abler and I worked together on last year and got a historic investment in. And so I'm really grateful for that. It was a really big deal to our providers and has made a huge difference. The thing is, if we build a bunch of these new shelters, which we absolutely need, which we need to do, then we have to provide them with the funding for operations and for case managers and for all of the kind of things that you need to run the shelters. And so these two pieces are bound together in a way. You know, the other thing that we really make a huge move on in this budget on homelessness is help for young people who are not connected to their families and who are out there alone. 16 to 24 is the main kind of age demographic that's served by the Homeless Youth Act. And the ages are a little bit different for Safe Harbor. Safe Harbor is specifically for young people who have been sexually exploited or trafficked and are homeless. And we know that young people are particularly vulnerable to exploitation, to sexual exploitation, because it's a lot of, again, across, it's unsafe for young adults even to stay in adult shelter a lot of times. And, you know, if you talk to young people, a lot of them have experienced abuse or assault, even if you're like 18 or 19 years old, it's an unsafe place. And so frankly, you have a lot of young people who are vulnerable to that sexual exploitation just in exchange for a place to stay. And, you know, I learned this and it was really, you know, it was affecting, but they had to lower the age of eligibility for Safe Harbor services from 13 or 14 to 10 years old to address the kids that were showing up to access these services. And so, you know, so we make a big investment in our budget in ensuring that young people have access to the services that they need to stay safe. So, you know, I mean, you will see we also have a commitment to, you know, shelter-linked mental health grants and some transitional housing and a close-knit kind of a pilot project to help stabilize young people in that same demographic, 16 to 24, who are staying with chosen family, which is often the safest and best place for them. But, you know, those folks who have an extra kid staying with them sometimes have trouble, you know, making bills or making rent. And so we have a pilot program to see if there's a way for us to support those family and chosen family units. So, you know, I guess I want to say that it's disappointing to me, of course, right, as the chair of the Preventing Homelessness Division, to basically see no investment in this area in this time when there is a large budget surplus and when we are saying what our priorities are for spending. And you know, the reason that it's disappointing is because I just, you know, each of us come to this work with our own value systems, whether it's rooted in religion or in ethics, or, you know, it's about our community's expectations for how we do the work when we get in here, right? But all of our faith traditions, all of our ethical codes talk about how we treat others, how we care for the poor and the vulnerable and those who need a hand. Every tradition that talks to us about how we are to act in this world and how we are to care for one another. And the proof of how well we honor and align ourselves with our values isn't in our words, it's in our actions, it's in our votes, it's in the choices that we make. And we have to make hard choices in these jobs all the time. But, you know, and I was thinking about how we were, I feel like there's this sort of like choosing winners and losers, picking winners and losers kind of like thing that we certainly get accused of over in the House. Probably we all accuse each other of it, right, at various times. But, you know, we are in a unique position in this moment. Like, we actually don't have to choose winners and losers. We have enough. We have the resources in this moment to respond to the critically urgent needs in all of our communities. We don't have to say we're going to help these seniors who are in long-term care, who are getting, you know, who have an automatic inflator on their reimbursement rate, but we're going to totally abandon the growing population of seniors that doesn't have a place to lay their heads. We don't have to do that right now. And so that's on us. We get to make the decision. Are we going to leave people behind? Are we going to let people fall through the cracks? Or are we going to step up and come up with solutions that work for all of our communities? If we let people fall through the cracks, it's a choice. It's our choice, and we can do better. And I hope that we will do better. Thank you, Madam Chair.
Thank you very much, Chair Gomez. Are there questions from members? And maybe you could take down the map.
Working on it, I'm sorry.
And thank you. Are there questions? Yes, Senator Hoffman.
Thank you, Madam Chair. And I guess one of these days, this Luddite will figure out how to find the raise the hand button on this screen, but, and mute my computer. Well, that would be Senator. Is it? Somebody's got an echo. So I'll do this as long as. Is that? You guys can hear this echo?
I think we're okay.
You sure? All right. I'll just keep talking. Help me understand. I think one of the things that always comes into play is in the discussion of homelessness is I very rarely hear the talk about intersectionality. And we know that the Wilder Foundation. I don't think that one's going on yet. Sorry, Madam Chair, we're still trying to figure out where this echo. Maybe I'll try a different mic. How about now?
I don't think we're not hearing it on the Zoom.
Okay.
I don't think.
No, we're good.
I'm not.
So the thing that comes up. The thing that comes up to play is, does that work now? There we there. It was me, by the way, Madam Chair, so I apologize once again. You could Google the word Luddite, and that would be, you could just do a flyer, John Hoffman, the Luddite. But the thing that always comes into play, we talk about, is the intersectionality. And we know that, for example, 46% of homeless people The children have to change schools. That's almost 50% of the population of that homeless, right? If you look at the Wilder Foundation study, that's pretty consistent, right? We know that 43% of the children that are experiencing homelessness there's some kind of learning gap that exists, whether they be actually identified as having an SLD, a specific learning disability, or not. And we know that there's an increase in bullying that occurs among children who are homeless. And so I guess the first question I have is, help me understand, when we're looking at this, are we getting those services? Because we have these services providers within the state of Minnesota. Are those folks right there? Are they helping children get connected to the proper school, the proper, place that is going to meet their unique and individualized needs? And I'll guarantee you this, if almost 50% of them could possibly identify or possibly be eligible for special education and or related services, then all of a sudden we have to make sure the Department of Education, specifically as it refers to when you were talking about Public Law 94-142, how that has an obligation to identify, assess, and evaluate every child with a disability in the state of Minnesota. And so are we having those intersectional conversations specifically in education? And I guess then that should lead to the next conversation or the next type of questions that I have too. Does that make sense, Aisha?
Representative Gomez?
Thank you, Madam Chair. And yeah, thank you, Senator Hoffman. I think that the answer is not enough. I think, and part of the issue is that there's a really great article in MinnPost today from Rhonda Otteson of the Minnesota Coalition for the Homeless that talks about just basically like that all these services are underfunded and have been for decades. And so again, right, like most of the state, you don't even have access to basic emergency shelter. But, I will tell you that, and I don't work in education, you might know, but I'll tell you that like last year, one of the big things that we were able to get done was a provision in the tax bill that went to counties to help families with school-age kids who are experiencing homelessness. And that was based on Homework Starts with Home, which you know about, which I know Chair Pinto and a lot of folks know about, but it's through Minnesota Housing, and it's really like we have to, under McKinney-Vento, we have to count, and identify the young people who are in schools who are homeless or in danger of becoming homeless. And so, and then this Homework Starts with Home wraps services around that family. It provides basically it's rental assistance and case management. I mean, it's not magic, right? It's pretty simple. It's like a lot of these families are in the position of, not being able to make rent, and they need extra help. And whether it's with, bullying, or with a student who has a learning disability, or whatever it is, that it's really like understanding that if we don't serve these kids now, we're going to be dealing with it down the line, right? And so, talking about, I hadn't put these together, but think about this, right? 46% of these kids have to change schools. If any of us as a parent have ever had to deal with it with an IEP and getting all of the supports for a student who's struggling set up for them, think about that. Then you have to move halfway across the state. And if you don't have those sort of basic life things taken care of, like how do you advocate for your kid? So for me, absolutely an intersectional conversation has to happen. But housing, if you don't have housing, nothing in your life works. Nothing in your life can work without housing. And so I'm like a housing first evangelist. I'm like, let's focus on getting people housed and take it from there, because that does a lot for folks. So I don't know if that's an answer to your question, but I appreciate the comment and the way that you're thinking about things. So
no, it does. It leads to keep going, but I noticed, Madam Chair, that Mr. Representative Incoming has got his hand up.
I don't know what that means, but Representative
joke.
Pinto.
In fact, that's a joke between Senator Hoffman and me that goes back a couple of years, but always good. Thanks, Madam Chair. And yeah, what that made me think about was, so as much passion as I brought to the child and early learning area, I have to say Chair Gomez is totally right. Because if you think we can have all kinds of programs during a kid's day, but if they're sleeping in a car at night or they're changing to a different couch every night, that's going to undermine anything else that happens. Meanwhile, you give a family a stable, safe place to live where they can go back to every night, they can be safe, etc. And think about the blossoming that happens when that occurs, and then think about again just the opposite. It's just so critical. I guess I also had wanted to note for members who are not aware, for a couple of years I was the director of statewide training and protocol development for the Safe Harbor system. So when Chair Gomez was talking about the connection between sexual exploitation and homelessness. My work as a prosecutor, I spent several years working on that and completely back up what she has to say. That's another aspect of this that's so important. Anyway, thanks, Madam Chair, and thanks to Chair Gomez for her leadership on this.
All right, thanks, Representative Pinto. I'll have to get the backstory on that term of endearment a little bit later on. Senator Abeler.
Well, thank you, and I appreciate the discussion. Representative Liebling, you and I have been here a while, and we forever have to make choices that we'd rather not make. And it's just the nature of the beast, Representative Gomez, about the choices we have to make. And and just to encourage people, like what we have done lately, last year we had historic increases in homeless funding. I don't remember the number, but it was a big number, and you were a key part of that. And the Senate agreed. We've had some money, and we're able to do a bunch of things, including emergency services was greatly increased. And so they're just, that's the good news, you know. And so as we look forward to what we're going to do, I was talking to Senator Hoffman, and I forget what percent of the adults in shelters have a mental health issue or a disability. And the question, I don't want to have 64%. And the question I would like actually to take offline, maybe sooner than later, is what's the role of the county in connecting those people to the services, since we're a state designed, county delegated system. And what is the duty, not just what would be nice to do, but what's their duty to those individuals in the programming and the waivers to which they're entitled, and then to bring people into, I'm looking at Senator Hoffman there, to what can truly be done to get at the root of this. And I would like to know from the counties, not now, but like in the next day or so, can you tell me what it is, how do you reach into those homeless shelters? How do they come in, and what is the role of a shelter in connecting those individuals, more than just they come and they sleep and then they go out again? And I was, probably Randy, the woman from Ramsey County, would be a good person to just talk about that, because they seem like they were really on top of their game. And then what's the role of helping people move through this as a time? I don't remember her name, but I toured the place over at St. Kate's. And they have, like, under 2 months, I think, is their turn there, where they help people get squared away and to move on. And so, Representative Gomez, that's my comprehensive thought as we're talking about this. And I just want to remind people, so actually, you don't have to answer the riddle now, but I kind of asked the Representative Liebling before. I don't know the total number of all the money in your bill. It's substantial, and I appreciate, why you're pushing for that. And as we look forward to our budgeting thing, if you could pick any one thing out of that, not for now, I'm not putting you on the spot, but it would be interesting to know what that one thing was. But I just want to remind people one more thing from yesterday that I mentioned, then I'll stop. I announced that in Coon Rapids, diesel was $5.29. Today it was $5.49. And for all the money that everybody thinks we have, there was no Ukraine war. There was no shortage of formula for babies. There was no $5.49 diesel. It was like $3-something, $3.89 or something. It's gone up almost $2. And I was just looking up, well, how much mileage do these trucks get? An average of 6.5 miles a gallon. So we're close to $1 a mile to drive your produce from anywhere. So, and so Representative Gomez and the rest, we have to be sure that what we promise to do, we can do. And as we go forward, and Representative Liebling, you've been through this as well. So I'm happy that we're all part of the process. I'm really happy for the tone from the Senate and the House. And so that's all I got. Thanks.
All right, well, thank you, Senator, and I'll call on Senator Hoffman in just a second, but I just do want to respond just a little bit. And of course, this is a process that's all about priorities, and what we have and what little budgets we've been given in our respective conference committees, or what budget we will be given, is in context of the entire budget. And it has been noted, we have a historic budget surplus, and the Senate's tax bill spends that money, a lot of it going to very wealthy people who I would argue, and the DFLers would argue, don't need those tax breaks. So, it's all a matter of priorities, and we have to make sure that we keep the entire frame in mind, because we all are in a position to advocate with our leadership for a budget target that makes sense. So anyway, I'm going to go to Senator Hoffman, and appreciate you bringing up the intersectionality. I think it's a very important topic, and it is kind of sad in a way that when we do things here at the legislature, we are in silos, aren't we?
Yeah.
And the people are not in silos. The people are the people, and sometimes they have needs that cut across these different silos. And I appreciate you bringing that up. It is a very important issue. But Senator Hoffman.
Thank you. And Madam Chair, the story is years ago we were at a soccer event, and then at the time Mr. Pinto was Mr. Pinto in the election, and they referred to him as the incoming St. Paul legislative Dave Pinto, and I never forgot that. So years later, I just say we all, so it's just an inside joke, and I'm glad you allowed me to do that, because I'm not funny. My wife told me that I'm not funny. Don't try to be funny. So. But Representative Gomez, I'm glad you and I share the same value structures. The system's not doing enough, right? And when I look at the reports of, as you start to look at 50% of homeless people have some co-occurring condition, right? 81% have a chronic health condition. 90% of those in the elderly population, they have a disability that limits their ability to work or do average daily living activities, right? And so the deeper question, I think, as we're looking at this and saying, all right, what is the system doing? Because if there's elderly waiver services, there's services that need to be out there, right? When you become on a waiver, a caddy or something, then there's the ability to get GRH, there's the ability. What are we doing as a system to make sure that our folks are on the front line? And I know, and Aisha, you were at that meeting with Hennepin County where they're actually placing those types of social workers within the environment. And I think when you're looking at, if we're going to look at this from a global perspective, what are the things that we can control and what are the things we can manage? It's really, if we're going to fix it, we get to the root cause of that. And the root cause, and yes, some would argue there's some stability factor in there, right, on the housing side of it. But yet at the same time, if I get somebody in a stable, structured housing facility, but I have no supports for them, have I really looked at the full global picture? And so I really think we should spotlight that on the full global picture. And I'm glad we're having this joint conversation, because it's really digging up about where are those services? Where are those folks in this conversation? And I think, Mr. Senator Abler was getting to that point, saying on those, where are those structured waiver services? And it all started with Representative Gomez. And so I appreciate this conversation, Madam Chair. And at that, I'll just say, look forward to seeing how we can get all those things, intersectionality, going together. Thank you.
Thank you. And I think we did hear Representative Gomez talk about the need both for shelter space and the services that go with it. So I don't think you'll get any argument from us on that. And of course, we do agree that we need to raise rates in the elderly waiver, which is in our bill. And there's a whole spectrum of need out there. And as has been noted, many of the services that we are attempting to fund are not getting automatic inflators. So if they don't come to the legislature hat in hand, they don't ever get an increase. So that's a big concern for us as we look to how to balance this budget across many, many areas of need. So with that, if I can, I'd like to, if we have Commissioner Malcolm with us, the plan right now is to talk a little bit about House Articles 1 and 2. And I'm going to, if the commissioner is here, a lot of the items in 1 and 2 come from the governor's budget. They come from the Department of Health. So, but then there are, of course, quite a number of items that are House items as well throughout these 2 articles. So I'm going to call on the commissioner, and then I'm going to make some comments after that, hopefully not duplicating what she speaks about. And but my plan, just so everyone knows, is not to go through the bills, not to go through the spreadsheet, and I think that's been very helpful the way it's been done yet already today. Honestly, I found that very helpful, but it's a little harder with these next couple of articles. There are just a lot of things in there. So I'm going to welcome Commissioner. Glad to have you here with us, and I'm going to give you the floor, and go ahead and describe for us what you have in Articles 1 and 2.
Well, thank you very much, Madam Chair and members. It's a pleasure to be with you. My plan was to really talk fairly at a high level about why the things that are in Articles 1 and 2 are here coming from us, not to go in detail through every proposal. We do have a number of staff on the call who can certainly answer questions, and we want to make sure we leave plenty of time for questions that members have on specific issues. But I just so appreciate the challenge that the Health and Human Services Committees and the eventual conference committee have every year. It's never easy to put this bill together because of the very scope of the issues contained in Health and Human Services, the intersectionality that you've just been talking about, that Senator Hoffman raised, and the fact that pretty much everything in this bill affects something somewhere else in the budget and vice versa. But yet we're, as you said, Madam Chair, often thinking about things in terms of their funding silos rather than their ultimate impact on the people of Minnesota, or even about future budget costs. And that is true in abundance when we talk about public health services and prevention efforts. So this is a lengthy list of proposals coming from MDH in a supplemental year, or even frankly in a normal year. And we do appreciate the frame of reference that folks are bringing to this conversation, and the need to focus on, well, why now? Why this year? Why is this urgent? Why is this critically urgent now? And certainly, as you know, we continue from a critically urgent standpoint to be still working on monitoring and responding to SARS-CoV-2. Of course, that has been an overwhelming focus of ours for the last couple of years, and being prepared for whatever comes next, because we know the virus continues to evolve. New variants are popping up literally weekly somewhere around the world, and we just have to remain vigilant. But this budget, these proposals really are heavily influenced by the impact that COVID has had on the people of Minnesota, and on a number of health and health-related issues, many of which predated the pandemic, to be sure, but have certainly been exacerbated by it. And so that we have in front of you proposals related to suicide prevention, opioid and other drug use, overdose prevention, a whole range of issues affecting people at high risk, including people with disabilities, who've been disproportionately affected not only by COVID, but interruption in care for chronic conditions that has affected a lot of people. And of course, the emergence of long COVID, which is going to be, we're quite convinced, a significant public health issue for a long time to come. And just one word on the long COVID proposal. This is not just about studying the condition. It's not about conducting clinical research. It's really intended to help assist healthcare providers and patients who are struggling mightily right now to understand the complex set of issues that long COVID bring, and where to connect for assistance. What are the best practices among clinicians? What are some standards of not only clinical care, but other resources and supportive resources that folks struggling with long COVID are going to need today. We're hearing heartbreaking stories every day, as I'm sure members are, about people suffering with long COVID who are really at a loss for how to get the kind of help and support they need. And so this is a very important proposal in this package to us. In addition to specific issues, and there's a range or 11 different prevention-oriented proposals in the package that cover a wide range of types of conditions and types of public health issues. But in addition to specific issues, we just think it's critically important to take this opportunity to come up with more robust prevention approaches to a wide range of issues. Prevention is a uniquely win-win way to improve health outcomes for all of our people, to address disparities, and to save healthcare costs. But we've talked for years about the paradox of prevention, that despite it seeming like a common sense good thing to do, from an investment standpoint, we don't do such a great job of it in the United States or in Minnesota when you look at the balance of investments between prevention and intervention down the road. And we understand why, quite honestly, that when it comes to putting together a budget, prevention investments aren't going to pay off in this budget horizon for the most part. And that makes it difficult. I know when faced with these difficult choices to make investments that are going to pay off much longer term. And that's really why with this historic budget surplus, this seemed to be a unique opportunity to make some of those investments in prevention that will pay off over time. And that will pay for themselves, I would argue, many times over in terms of improved health outcomes, reduced disability, increased ability for people to participate in the workforce and in the life of communities, and in avoided healthcare costs. And so I think even though prevention is not a one-time thing, some of those I would urge us to just think about prevention investments as something that will, and I think the Results First program here in Minnesota and around the country is showing this, does pay off over time in terms of just, most importantly, health benefits to people and reductions in disparities, but also economically in healthcare costs, but in other cost drivers for the state as well, whether that's education or economic development or housing or you name it. So I think, again, this is one of the reasons why you saw a pretty robust set of proposals from us through the lens of a rare opportunity to make some investments that will pay off over time. And certainly another important area of investment, and we talked about sort of the relationship between some of the DHS proposals, some of the MDE proposals, and some of the health proposals, are really aiming to try to improve early childhood development, childhood readiness, also a critical need in our state, certainly, and a way to make investments that will pay off in the future. And most importantly, again, in terms of improved outcomes for our people, but also in terms of ways, sustainable ways to deal with some of the cost drivers in cost. So some of the Healthy Beginnings efforts the proposals are to fund them at levels that are more than just incremental increases in things that are evidence-based that have shown good results. And home visiting is certainly one such example. And the healthcare workforce. I know this, both the House and the Senate have spent a lot of time looking at the healthcare workforce. Certainly DHS has a number of those proposals. MDH has a package of proposals for revitalizing the healthcare workforce that are aimed certainly at rural healthcare workforce and parts of the health professions that are facing particular shortages or unmet needs on part of the public. So increasing the number of clinical training sites, increasing rural training opportunities, increasing mental health training opportunities are all, we think, critically urgent to deal with, again, a workforce challenge that predated the pandemic, but has certainly been exacerbated by it. Finally, we think it is truly critically urgent to strengthen the public health system itself at this time. and we appreciate the support that that members have shown to your local public health agencies and to us at MDH over these last couple of very difficult years. What we've known for a long time, but again, we've just seen it brought into such sharp focus over these last couple of years, is that for literally decades, we've had a steady erosion of funding in the public health system at the federal level, at the state level, and at the local level. And really combine that with emerging health threats, with whole new issues, and with kind of rising complexity around data, around analytics. And what it's left us with, this gap between funding and need, can best be described as a patchwork quilt of public health programs that are very narrowly funded. All of our federal funding comes for this disease or this population or that population. Mostly true at the state level as well, with some very important exceptions around just the kind of the core support to local public health agencies. But everything else is programmatic or categorical, leaving very little, like none, investment in the infrastructure itself. And that's what we've seen, I think, come at such a great cost over these last couple of years. I think we've seen in the incredible mission commitment of people in the public health workforce at the local level and at the state level to just keep on pushing through this long marathon and this really grueling experience. We certainly know that's true for healthcare workers. It's true for public health workers as well. So we've seen their commitment and their dedication, and the strength that exists in the system and in the workforce. But we've also seen the gaps. The gaps in the public health system have really been put into pretty stark relief through this pandemic. And we simply have to be better prepared in the future, not only for epidemics and pandemics, but for the wide range of things that our communities count on us for. State and local and tribal public health departments have a truly unique responsibility. We are the only ones who are responsible for really looking at the health of the population as a whole, without regard to insurance status or where people get clinical care or what the conditions are in their particular community. But truly to have eyes on the health needs of all people. And that cuts across infectious disease, chronic disease, environmental health threats, things that affect the entire community. And our communities really look to us for monitoring, for data, for keeping up with what's new, as well as what are the long-term trends that still haven't gone away around chronic disease and some of the largest factors there. They also rely on us for health guidance, for, well, what do we do if we, and now long COVID is yet just the latest example of one of the important roles that public health plays, is to try to assemble the best information that we have to make it available for people and providers to make the biggest difference possible. Also, a critical role the public health plays is to sort of be the community convener of partnerships around that whole wide range of health threats. And that is something that I think many of our partners in communities have only deepened their appreciation for the role of public health in supporting businesses and supporting schools through these difficult times of knowing what was going on, how to mitigate risk, how to keep moving forward, and then working on these very broad community issues about how do we build a healthier community going forward, knowing that building a healthier community cuts across all of these different dimensions that Chair Pinto, Chair Gomez, Chair Abler, all of you have been talking about. So we really just think that now is a great time to acknowledge that we have got work to do as a nation and as a state to really strengthen the public health system that plays such a wide range of roles. Certainly infectious disease has been front and center, but the impact of public health on local communities goes far beyond that. And so the funding that is proposed in the governor and House position would make a big difference in building up the capability of the public health system to be more ready to serve that, community health leadership role, as well as preparedness for emergencies. So that doesn't depend on where in the state one happens to live, but there is a foundational set of public health capabilities that truly exists for all people, all communities, all people within communities. So that was all I really wanted to cover, Madam Chair, with respect to the investments in Article 2, and actually a couple of other articles as well. We do have a number of policy proposals, many of which are non-cost and I think pretty technical and pretty non-controversial. Hope and happy to respond to questions on either some of the budget proposals or the policy proposals, but I will leave it there for the moment.
Thank you very much, Commissioner. Really appreciate that. And of course, we didn't coordinate our statements, but I kind of thought you might talk about the public health system, and I'm really glad that you did that. And that's, of course, very important to build and rebuild our public health system, because it's the kind of thing that until we don't know we need it until we really need it. Often it goes on behind the scenes, and people just take it for granted if they know it exists at all. And yet it's so critical to maintaining our health as a population. So really appreciate that. Are there questions for the commissioner? Maybe I should just do my piece, and then we could have some time for discussion. And unless there are any specific questions for the commissioner right now. Don't see anything. Okay. All right. Well, very good. So, and as the commissioner noted, there are a lot of small provisions, a lot of policy provisions in these two articles. And Senator Abler and I have spoken about, how to, because we have a very large challenge here before us as a committee in a very short time, that, he's talked about doing the same and similars, or, getting ready to adopt them. And I hope that we can broaden that to include the non-controversial items, of which we think there are many. And I know that Commissioner is, in her staff, can talk about many of those items that come from her department. And there are many from DHS as well. And hopefully we can work on some of those, and they won't be challenging, because it's just a matter of understanding what they are and things that we can all agree on pretty rapidly, I hope. But so just to kind of expand just a bit on, in a general way, on some of the things the commissioner has mentioned. So in these two articles, one of the big things that is a huge priority for the House, and I think it is for the Senate as well, maybe though in a somewhat more limited form, is the workforce. And we know when we look at what's happening today and what is projected to happen in the coming years, that we have a real problem with our healthcare and our, generally speaking, our caring workforce, and including our mental health workforce. And we know that we've had, because of the pandemic, most likely a big uptick in the need for mental health services. And our workforce is really stretched and is probably not up to the challenge in terms of just having the numbers that we need in the places that we need them. So there are a lot of items in this bill, in the House bill, that go toward expanding the workforce. And I just want to mention a few of them, and I'm not going to read them to members, but a lot of them have to do with loan forgiveness. But I want to really make it clear here that when we're talking about loan forgiveness, we're talking about using loan forgiveness and some scholarship funding and some other kinds of funding to really incentivize the kinds of service that we need. So when we're talking about loan forgiveness, we're trying to incentivize people to, say, work in a shortage area, often rural areas, where we know there are shortages, or work in a a part of the spectrum of healthcare where we have shortages. So a lot of what is in this bill goes to that. So we've got loan forgiveness for, say, acupuncturists. I think this is brand new, but acupuncturists who work in rural areas. We've got quite a few items here for nurses, nurses who teach, school nurses, and nurses who work at the bedside in our hospitals. And I'll talk more about that in a minute. We've got for mental health professionals who supervise so that they can be training, we can get training to other mental health professionals and get more people licensed in the field. We've got loan forgiveness for public health employees to help with what the commissioner was just talking about, building up our public health agencies. We're removing some barriers for supervision for mental health professionals to get the supervision they need to get licensed. And we have scholarships, extended scholarships and loan forgiveness for employees who work in home and community-based services, which is another area that I know we all share concern about the very limited workforce. So that is, for the House, a really important part of this bill. I want to especially mention nurses who work at the bedside in hospitals and have been there through COVID. And I don't think I probably need to tell anybody that our nurses and our larger, healthcare workforce who've been working with patients who have COVID have really been through hell these last couple of years. And many of them are leaving the profession. We have a real problem with nurses leaving the bedside. And it's really important that we have an item in this bill that I know is controversial for many. I know the hospitals, generally speaking, don't like it, but it is really important that we let nurses know that we have their backs so that when the next pandemic hits or the next healthcare emergency hits, that they're there. We cannot have care that people expect and need if we don't have these really important nurses. And we have a nationwide shortage. This is not just a Minnesota thing. But the first step in solving our shortage is keeping the nurses that we have. And to do that, we need to let them know that we recognize them as professionals who want to do their jobs as they know they can do them and want to get the best outcomes for their patients. And so somehow we have to find a way to recognize that and to let our nurses know that that is how we view them and how important they are to us in this state. I won't really address the piece about the rebuilding the state and local public health. The commissioners talked very effectively about that. I will just talk for a moment more, though, about this, something we talked about at the beginning when Senator Abler asked me what I thought was, priorities and so on. And just another big priority in our bill here is the maternal and child health piece. And I won't repeat what I said earlier, but there are a number of different things in the bill. One that we really haven't talked about a lot is the anti-lead provisions. As everybody knows, there's no safe level of lead, no safe level. So any amount of lead in a child is harmful, or in an adult for that matter. And this has to do with brain development. If a child is lead poisoned at a young age, it can damage their entire life. There is no fixing the damage that lead causes on a person's development. So it's really important that when we have the resources, which we have now, and we have partnership with the federal government as well, that we do what we can to try to address this issue. And it's a serious issue in Minnesota as it is in other states. And so we have a number of provisions from the Department of Health, but also from members to try to really address lead, eliminating lead in daycare centers, in homes, in schools, the places where, obviously we have to prioritize, but we think we should prioritize where the youngest children could be in contact with lead and do what we can. And I won't go into it in great detail, but that is really important. Commissioner, of course, talked about the long COVID. We also have a bill in here from Representative Bolden to put some money into being able to have the state provide masks and provide testing against COVID for those who, obviously many Minnesotans still struggle to be able to provide those things on their own. And clearly, unfortunately, the pandemic is not going away. It can have long-term impacts even for people who survive COVID. And this is something that, as she said very ably, this is an emerging serious public health problem. We had a couple of hearings on it in our committee, and it is something we all need to pay attention to. There are some other really nice provisions in this bill. There's one from the Minnesota Medical Association that's called POLST, P-O-L-S-T, and has to do with, has to do with when people have decided that they have a medical order, like they want to have a do not resuscitate order, and they have decided what they want their healthcare directive to be, but then when the emergency people show up at their door, they have no idea that that's in place. And so this is to start looking at how we can have a system where everyone can find out what a person's wishes are. And so this is just the very beginning of starting to figure out what this would look like and how we could do it. But it seems like a really important system if we care about people's, the nice term health freedom. If we want Minnesotans to have the freedom to make their own decisions about their own health care, then we have to have healthcare providers be able to find out what those decisions are. So this is an important provision for that reason. And then there's another nice one in here that I just want to mention. There are a lot of nice provisions. No one should think that because I'm not mentioning them all, that they're not all good ones, because I think they are, or they wouldn't be in the bill. But there's a very good provision in here about having hospitals screen patients for eligibility for public programs or for the hospital's own charity care program when they are in the hospital, and the hospitals are not opposed to this. And, medical bankruptcy and just crushing medical costs are still a huge problem for Minnesotans. And to have people be incurring these costs when they in fact could get help for them is just something that should not be happening. So that's somewhat of a small provision, but may be very, very important to some folks. So I'm going to stop talking there. I'm not going to, as you know, go through all the provisions in these two articles. There's a lot there, but I hope that we can, even though the Senate did not hear these that we've been mentioning, and so they're not in the Senate bill, these are House-only provisions. I hope that there are things that the Senate will find to be helpful. Some of them are no cost, low cost, and just to get the discussion going. And I hope we'll be able to include a lot of these in our conference report. So I'm going to pause there and take questions from members, and hopefully we can have a little bit of discussion. And so, Senator Abeler.
Well, thanks. And I want to appreciate the commissioner coming, and clearly there's a lot of thought in these projects as well. Could I use the word ambitious? Representative Liebling and Commissioner Malcolm. And, and I just think it's going to be a matter of priorities. And I think that, should some of these not quite be all funded this year, that they make a good discussion and the base for future discussions when we're trying to establish our whole, 2-year budget. But, I think that the thoughtfulness and caring for, the well-being of Minnesotans comes through from the House. And, I'm always concerned about lead and, giving everybody a chance to get a fair start and not be, that's just, I'm just surprised we're still worrying about lead. I just don't know why we can't get that fixed myself. That's my personal thought, and mercury as well. So anyway, that's all I got. So thank you for a thoughtful presentation.
Thank you so much, Senator Abeler. And I know maybe that was sort of not a, I don't know if you were really asking the question about, why we can't get rid of it, but of course, one of the real big reasons is it's so pervasive. And often getting rid of those lead lines and the fixtures in homes and stuff that are leaching lead can be extremely expensive. And of course, that's why, but we're, we got to start. That's the point. We've got to keep pushing forward on it, because every bit of lead we save a child from is really something. And I think it's so important. So thank you for those nice words. Senator Benson.
Thank you, Madam Chair and Senator Abler. I know that we made investments in lead in the last budget, and I know we did significant investments in maternal child health. We did big investments in home visiting services. And so I guess as we go forward, I'm going to expect to see what happened with the money we already pledged to spend, what gaps you're trying to fill, because we did a lead testing program that intersected with schools. We checked that. We have really broad home visiting, so the population you're reaching might not be an optimal or next step population. So I have some significant concerns over the piling on that's happening here. But Representative Liebling, and I know Commissioner Malcolm is on, the House's request is over 200 new FTEs for the Department of Health. Was that an accurate number from yesterday?
Maybe the commissioner could respond, but I don't think that was just the Department of Health number. I might be wrong, but Commissioner?
I'm sorry, I don't, Madam Chair, excuse me, and Senator Benson, I don't have the FTE number right at my fingertips, but perhaps one of my colleagues does. And if not, we can check that while we're on the line here and get back to you. Sounds high to me, but I will check.
Yeah, and I would just say to Senator Benson, I appreciate your concern about, I guess what I would call is context, right? Everything we do, we're doing it in a context of what's been done, not only what the challenge is, what the problem is, and what the scope of the problem is, but also what's been done to address it up till now. And as you so well understand, a lot of times we put things in place that then play out over several years. So we do want to understand how those things intersect. And I think that's a really good question, and one that we should be asking. But I just would say to the senators that we need to do that with your provisions as well, because a lot of the places you're spending your money are places where there's already significant spending that's going to happen by operation of law already. I do want to say in the lead area, I think we didn't do a lot. We did a little bit on lead, but the challenge is as we were just discussing, the problem is big. And also this year there's an opportunity because of the infrastructure bill that was passed federally, that there's an opportunity to leverage some of that funding to actually get rid of lead lines and things like that. And I know the House has done across different budget areas in the House, we're really trying to leverage that funding, because it is so expensive to take out those lead lines and replace them. And so here's Margaret Kelly, and I think she's going to be able to give us some additional information. Welcome.
Thank you, Madam Chair. Margaret Kelly with the Department of Health, Deputy Commissioner. And the number from Senator Benson does reflect the FTEs being added both in the governor's recommendations that were picked up by the House and in the proposals being added by the House. And there are some proposals that are significant in size that have more FTEs than others, specifically where we're giving out significant grant amounts and need to monitor those grants to ensure they're being allocated and spent appropriately.
Thank you. And then,
Senator Benson?
thank you, Madam Chair. And at some point, Commissioner Malcolm and Commissioner Kelly, as we talk about the new federal suicide hotline, I know there are a long list of suicide grants that are already given to the department, at least if my memory serves me correctly. I'd like to see where those grants are going and if we are incorporating those funds, and if this is supplemental, additive, supplanting funds that are requested in the governor and the House budget. And so I'd need a crosswalk from existing grants to future needs.
Commissioner or Ms. Kelly?
Certainly, Madam Chair, we can, and Senator Benson, we can put that together for you. I do believe there is somebody online who may be able to speak to that right now, unless you just would like a response in writing.
As we, I'm sorry, Madam Chair and Commissioner, as we go forward, I just need to see what's happening with existing grant dollars. So I'm sure that somebody's already done this analysis. Making it available to the committee would help us to understand what level or type of investment we would need in order to work on the suicide hotline.
Certainly, we can put that together and send it over for you.
Okay.
All
Thank you,
right,
Madam
thank
Chair.
you. Thank you. Representative Pinto.
Thank you, Madam Chair. This is actually just following up on Senator Benson's question about home visiting, and it may be that we'll get some more detailed information about how past money was spent. But I just wasn't sure if Commissioner Malcolm would have anything more to say about the proposal to expand home visiting, because I know it's a really powerful investment. I remember talking with Senator Benson last year about it, and she's long been a champion of it. Want to make sure the money's being spent well. And I just don't know if there's anything Commissioner Malcolm would want to say more in follow up about that line of questions. Thanks.
Yeah, thanks, Representative Pinto. Commissioner?
Madam Chair and Representative Pinto, Senator Benson's quite right. We did make an investment in home visiting last year, but that expansion still was more incremental. It was not trivial, but still left a lot of people without access to that program. So the governor proposed something even more ambitious than what the House picked up, including a pilot of a truly universal approach. And again, stressing that this is voluntary. No one is required to have these services, but it starts with prenatal visiting and goes through the early years of a child's life to just make sure that parents have the support that they need and are connected to resources that can help them with parenting and help connect the child to appropriate resources. So I can get a specific quantification of how much further expansion this added investment would mean. But certainly, I think we didn't meet the whole need last year. And this, again, with the budget surplus, seemed an appropriate opportunity for expansion.
Madam
you.
Chair,
Representative
thank you. Maybe I'll just note I recalled something like, I think it's like 11% of the eligible, low-income babies receiving this support. And I don't think our proposal will get to anywhere close to 100%, anywhere close at all. But I think research shows pound for pound, it's a really, really, really powerful intervention, one of the most. So anyway, thanks, Commissioner, and thanks, Madam Chair, and Senator Benson as well.
Yeah, thank you. So
Madam
Senator
Chair.
Benson and then Hoffman. Go
If
ahead.
I could, and to Representative Pinto, thank you for your work on this, and Commissioner Malcolm. But what we know is that targeted home visiting to at-risk populations does make a big impact. The further we get from at-risk populations, the further we get from targeted, meeting high standards, proven effective methods, the more that impact diminishes. And so when you say only 11% of the need was met, I'd like to know what population is defining the need. Because I thought we were doing a pretty good job for the most at-risk populations and making that accessible, and with the public health grant, increasing that local support. And so if there's a move to a universal home visiting, I'm not sure that there's something actually driving that need that meets a good data standard for proven effective. We went to theory-based, and we allowed that for populations where there wasn't good demonstration data. And so let's be cautious about how far we get down this path, because people will claim successes that haven't been proven, and they'll claim them for populations that haven't been evaluated or weren't targeted.
Yeah, I know Representative Pinto, I know you want to continue the conversation, but Senator Hoffman is waiting. So if you want to respond, let me go to him, and then if you have something more, we'll go back to you. Senator Hoffman.
Thank you, Madam Chair. Actually, this is part of the whole conversation because you're really looking at, when you're talking about home visiting, and this is what, early on, an hour and a half ago, I'd asked a question about Title V, and specifically Title V and the prenatal, perinatal, but there's also there's a piece in there about early intervention that is supposed to coordinate, collaborate, and be comprehensive with early Head Start, Part C of IDEA, right? All those programs that are camped out in different silos or jurisdictions are supposed to be working together. And so when you look at expanding the home visiting program, right, there's funding. I know there's a memorandum of agreement. There's 45 different memorandums of agreement that the Department of Human Services have. This is one of them that the Department of Human Services to actually funnel some money through, if I remember reading that right. If I'm wrong, I'm wrong. I've been wrong multiple times before, but I usually take a snapshot of where early childhood funding is coming, and this is one of them, that there's a memorandum of agreement. But the thing that I'm still questioning on, and this is where I'm glad to hear this global conversation, is we have, and I'm going to put that out again, Part C of IDEA, which is early intervention services to birth to 3 that fit in certain categorical structures, right? Early Head Start, which is a whole different venue, but it comes through the Division of Adult Children and Families, which is out of DC. Then you have Title V, which is coming through the Maternal Child Health Bureau, right? MCHB side of it. That's connected to the Social Security Act, right? That's early intervention. Then, we pull into aspect all these other early childhood family and all these other things, and it just boggles my mind. Shouldn't we be having a conversation about, is this activity going to fit somewhere within that structure or the collaboration? That's a systems approach to it. And so I guess I'm throwing that out there, saying that if we're going to do increased home family visiting, how is it tied back into all those other systems that Minnesota has? And I won't even bring up when Jesse was governor, he had this Children, Families, and Learning, which had put all the early childhood programs under one umbrella. But I'm not even going to go down that tunnel there, Senator Aylor. So thank you, Madam Chair.
Okay, yeah, thank you for that and for not going down that tunnel. Okay, Commissioner, did you want to respond to that before I go back to Senator Benson?
Madam Chair, Senator Hoffman, I do appreciate you kind of lifting up the larger systems to which this is connected. I think one of our staff in the Children and Families unit is pulling together some information. You may have it in an email already, but certainly appropriate to understand how these things are connected in and leveraging federal funding.
And then I see Ms. Wick on the
Yes.
Zoom.
Hi.
Welcome.
Thank you.
Please introduce yourself.
Chairman Liebling. My name is Kathy Wick. I'm the Assistant Division Director for the Child and Family Health Division. And I was hoping I could have maybe addressed a portion of Senator Hoffman's question regarding Title V. Senator Hoffman, you were asking if these systems are working together. Is that more or less getting to your question? Because the proposals that we have made in particularly the Healthy Beginnings Supplemental and the infant health is a direct result of a needs assessment through our Title V grants. And with our local public health, that additional needs were identified to support infant mortality reduction efforts by making additional funding available to those communities most impacted. And there is a lot of braided funding that works together to try and address the needs that have been identified.
Madam Chair.
Senator.
Thank you. And thank you, Ms. Wick. That's exactly where I was going. I'm Title V reviewer of other states, and I look at what Ohio has done. I look at what Arizona is doing. I look at what California. California leverages $38 million of federal money into a $4 billion system, and they have embedded the interaction between all those systems. And I'm so glad you said Healthy Beginnings and infant health. That's just another program that's added in there. And I'm happy to hear that the Title V grant request in your response to the feds is within that. And so the deeper question is, are we then moving into a coordinated or a comprehensive program establishing, looking at early Head Start, Part C, et cetera? Is that, if we're not there, why aren't we there? Why are we still having conversations about funding one bucket when we're not assuming all the other buckets together? And that, I guess, it's a deeper systems question, and it's just how it should be. So does that make sense to you, Ms. Wick?
Absolutely, Senator Hoffman. I can assure you we are working across departments with the Minnesota Department of Education and DHS, particularly working with them in the preschool development grant, which is around systems building for all of those systems that you have mentioned, working to improve outcomes for 0 to 8-year-olds from the very inception of life to making sure that they're getting the supports that they need. The Healthy Beginnings legislation includes working in those systems with infant health, as well as implementing electronic screening proposals and continuing the Help Me Connect website that has been developed through the preschool development grant that links families and providers to resources through an electronic means, greatly increasing efficiencies across these systems. So it's about linking systems.
Yeah, okay, so thank you very much. Let's go to Senator Benson.
Thank you, Madam Chair, and I'm not on the home visiting any longer. The surprise billing and balance billing, I understand there was a federal law that is having some interaction here, and I'll need to see that language and make sure we're not going beyond what the federal law requires. And I should know this, but why is this in health instead of commerce when it's about complaints? And I know there's some network adequacy interaction, which is handled at the Department of Health. But if someone from health could help me understand from the administration's point of view why this becomes a Department of Health issue and not a Commerce, Consumer Complaints and Monitoring issue.
Commissioner, do you want to take that one, or you have someone else?
Yeah, Madam Chair, Senator Benson, I think we have Assistant Commissioner Diane Rydrick on the meeting here, and she can speak to that. We do coordinate, you're right, about sort of the cross-jurisdictional issues between health and commerce, but there are a lot of collaborative conversations when we're looking at things like the Federal No Surprises Act. But if Assistant Commissioner Rydrick is on, I'd appreciate it if she'd chime in.
Okay, I see her. Welcome.
Yes, thank you, Madam Chair and members. I'm actually going to pass it over to Susan Castellano, who is the Director of the Health Policy Division. But we'll just note, as Commissioner Malcolm noted, we have worked very closely with the Department of Commerce on this language, and I'll let Susan explain a little more.
All right, Ms. Castellano, welcome. If you would just introduce yourself, please.
Sure, thank you. Representative Liebling, my name is Susan Castellano. As Diane said, I'm the acting division director for the Health Policy Division, in which sits the Managed Care Systems section, which regulates managed care entities for the state. So we work very closely to regulate HMOs, while Commerce regulates the insurance companies that are not HMOs. So we both have complaint systems, and they come to us respectively. And so that's why it involves both of us. But yes, Commerce has been intimately involved in the development of this language. We have a work group. So.
Yeah, thank you. Senator Benson.
Thank you, Madam Chair and Commissioner. As we go forward, I'd just like to understand, and I didn't track the Commerce portion of this as Commerce was going through finance. And so I'll need to understand what role Commerce is going to play and what role health is going to play, because consumer complaints can land in both places, and I just want to make sure that A, we're not being duplicative or going beyond the minimum essential federal requirements.
Okay, thank you, Senator. And Senator, I just want to say it's really great to be working with you again, and I do appreciate your thoroughness and the seriousness that you bring to all these things. I do have a little concern though, and that is our time is so short. And I know you're so diligent and you'll get right to finding out what you need to do, but I just, I just worry that we're going to just run out of time. But that's for general for everything, and you're just reminding me of that. So, but thank you for your questions.
Madam Chair, and I apologize, I'm not going to go into deep detail, but there are big things that are new, and so I want the department to be aware, and I can do a sit down and walk through on some of these things with the department, and I'll take the language home and follow up.
That would be wonderful. Thank you very much. Representative Pinto.
Thank you, Madam Chair, and maybe this can help speed our process up a little bit. Just to be sure, I really want to be sure to ask MDH and any advocates for home visiting to provide, just to go back to that topic, to be able to give us some concrete information about how targeted. My understanding is that the proposal is actually quite targeted, going back to that point, but if we can make sure to get information about that, about who would in fact be benefited. My understanding that right now there's only like 11% of kids being served. It's not all kids. It really is, I think, 11% of quite low income kids. So of the targeted population, we're only serving about 1 out of 10. But if we could please get information on that, that'd be helpful. And then the other topic was raised by Senator Hoffman's questions about the different early Head Start and different programs. There's a proposal for the community solutions for healthy development grants. And it occurred to me, Commissioner Malcolm, that might be a bit of a response to Senator Hoffman's question, or just if you could comment briefly about that, if that's okay with you, Chair.
Yeah, Commissioner, are you able to comment about that one specifically? I know that that did come from the governor's budget, but it also, I think, had some House input.
Madam Chair and Representative Pinto, yes, that community solutions is really an important way of having programs that are responsive to what are causing some of the gaps in early childhood development, being designed by the communities that are experiencing them, rather than a sort of a top-down, one-size-fits-all approach from the department. I don't know if we've got anyone from the Health Promotion Chronic Disease Division. I know there are staff on the line. If anybody would like to speak to community solutions, and for that matter, the same staff might be able to say a little bit more about home visiting. So Director Daywood happens to be on. And if not, we can certainly get that back to you.
Jan, this is Mary.
Oh, Assistant Commissioner Manning, thank you.
Okay.
Sorry.
Ms. Manning, go ahead.
Committee Chair. As far as
and could you say your name?
This is Mary Manning, Assistant Commissioner, Health Improvement Bureau. First, I'll go to the community solutions. I think what's really great about those resources is that they are enable us to they're actually, like Jan, Commissioner Malcolm mentioned, that they are resources that can be utilized to meet the community concerns brought up, but they also are related to the health assessments that we find in looking at the Part C and maternal and child health, and a number of the different assessments that we do related to early child development and those other assessments. And a lot of times they're really some good glue that helps us they would be able to help us really align those things really well, where some of the resources have some constraints, but really can make, when one program is working in an area and is getting funding from one area, it really helps to make sure that they can align really in a sensible way. Speaking to the issue of home visiting, in addition to the resources only hitting about 11% of those who are income eligible, the resources we were seeking will also be very really important for us in addressing the needs of children, especially those whose families are often not as interconnected with some of the systems issues, where the child are going up until the 8-year block, and they don't have as many resources and as many programs. Many of the school things go till right before preschool or right before the entry into school. And a number of the children would be eligible for assistance up until 8. And then there was another block of home visiting where we were really looking at serving children whose disability goes even longer than that, where we could have children who's would receive home visiting services and support for their families who go beyond that even early elementary age, because that is also a gap that we see. And that is so devastating for so many of our families that really need that interaction. And they might even be in an elementary school, but have aged out of that at that age group. So the home visiting dollars that we envisioned still weren't quite universal, and not universal in the sense that every person would get the home visiting, but that we would be getting much closer to what we believe the need is. Okay, so, and we can still get more information, but I think in general that answers some of the questions I think that Representative Pinto was trying to get at.
Okay, thank you very much.
And
Okay,
Chair Liebling, this is
Yeah.
Dawn Reginger. I'm the manager of home visiting at MDH. I can just quick jump in with a few numbers. So a few years ago, the Department of Health, the Department of Human Services, and the Department of Education got together and agreed on what would be a target population if we wanted to define it. And it was 110,000 families, if you look at under age 5, that are under 185% of poverty. And through home visiting right now, through the state investments and the federal investments, we are serving 12,000 total, and a little less than 4,000 of those receive the targeted home visiting, which is long-term home visiting and evidence-based.
all right, thank you very much. All right, members, other questions? We are getting toward the end of our time here. And I know this is, these are long blocks of time, and I'm very appreciative that members have been so attentive and we've had really good discussion and good questions, I think. Any other questions? Okay, any closing comments that members feel, or Commissioner, anything you want to close with today?
Well, Madam Chair, thanks again for the opportunity, and thank you, members, for your good questions. It's clear that you know a lot about these issues and the need. Appreciate your questions to help us sharpen our case here. I do think that this does, some of these proposals really do represent trying to build on things that we do have positive experience with and we know work, but that we know are not meeting the full need. So very much trying to be driven by where the evidence of impact is the strongest and how we can leverage those gains. So thank you. I know we have many more conversations ahead on the details. Please don't hesitate to reach out anytime, Madam Chair or members. And thank you again for your time.
Great, thank you. Thank you, Commissioner. And thank you to the staff as well. And so Senator Abeler, I'm gonna turn it over to you if you want to talk about, let's see, I'm not seeing him right now on the screen. But Senator Abeler, if you're available, do you want to give a preview of tomorrow?
Yeah, sorry, I was just in a side conversation. I didn't want to disturb people. Anyway, I want to thank the House for, I think, a really good discussion on Representative Liebling. I'm going to accuse you of having these be some of your priorities, so I'm just going to leave it at that. But I think it was a really good discussion, and Representative Pinto and Gomez and Commissioner, thank you for being a part of that. Before I get to tomorrow, we looked up the Senate bill, Representative Liebling. We actually have 13, I think, 0.1 FTEs. So sorry to crush the burden of the workforce there, but that's, and it actually seems to go down to 12. So I don't know how that works, but sorry about that one person. You better check to see how long your contract is. Anyway, and just when I was talking about diesel prices, that had nothing to do with any truckers that I know, but I just want to make it, the point was that I'm insecure about the $9 billion. And so I think as we make our decisions, we want to make sure what we can decide is durable. That was the point I was trying to make. So if that wasn't clear, maybe it was. But so tomorrow, we're going to meet at 1 o'clock again. And Senator Utke will go through, and with Senator Benson's help, I suppose, whatever, all the things we haven't covered yet that are in that turf. That'll be the healthcare, Department of Health, the boards, and whatever. Maybe the Board of Pharmacy. We can learn about that area of agreement. Maybe we'll start with that one. Never mind, and see what we like about that. But they will cover that for the first period of time. And we're a little insecure about our presence on the tax bill, but there's some things that are very important. And Representative Pinto had a question yesterday that I thought was really well asked about, tell me about the math about the DWRS. And I realized that we haven't had a really good math discussion about that for a while. And so we're going to answer that question with the help of some of the people who know about that. And Mr. Burdick, if you could make sure that the math people are around on that topic. And I was thinking maybe a 15-minute presentation on that topic with time for questions. And then also on the nursing home matter, it seems that there's some uncertainty about if they even need the money or not, given this 8% and all that. And so I don't know if anybody knows, I always liked math. Math was my favorite topic. Numbers are pictures. And anyway, I just thought it was great, so I'm really looking forward to that. And so we've asked some people to come talk about that, maybe some different faces than what we're accustomed to, just to kind of mix it up. And then there was the third topic, which just seems to fall to the bottom, which is very concerning to me, and that's the non-emergency medical transportation. And given today's discussion about the concern for the people who really need some extra help to get around where they have to get, the bulk of the individuals using that are people that are not very wealthy, people who are very heavily challenged, and I suppose they have an address to be dropped off at, but they could be from anywhere. And so that is also, I think, at risk. And so, again, a similar, maybe 15 minutes. And so I don't know what to do after that. We'll just kind of see how the time goes. But I would like at the end of that presentation and that people at least understand the math and see if it rises to the level of what they think would be critically urgent. And I'll give you a hint, I think they are, but that's something we'll have to determine going forward. And then if the tax bill gets done, if we're just kind of relaxed, then we can then see what else makes sense to do. And Representative Liebling, I'll even maybe be happy for some advice from you, seeing how the time works. Like yesterday, we got through the material way quicker than I thought, and so that's my thinking. And if you want to react to that, Representative Liebling, I'm happy to hear your comments.
Well, thanks, Senator. I guess I would just say, sort of on the substance, I mean, that sounds your plan for tomorrow. It sounds fine. I guess I just would push back on one thing you said, which is that the House does not say, we don't say that anybody doesn't need the money. That's not our position at all. I think our position is just that we have to, we have a limited pot of funding, which I think you've alluded to a number of times. We don't know how big it is, but obviously it doesn't really meet the needs. And we're going to have to set priorities. And so as we try to set priorities, we need the whole context, which was what I think Senator Benson was talking about in some other areas. We need to understand the context of how much funding is already going into those areas, what the growth already is, and what the need is. And, you know, what does the money buy in different areas? I think that's going to really help us make decisions, because we all want to meet the needs. It is not, we in no way think that anybody is, you know, oh, they're fine. That is not our position at all. So I just want to make sure that that's clear. And
Well,
then,
Representative Liebling, let me just comment on
yeah.
that while you're still there. I appreciate you correcting my misspeak. I say you said it the way I intended, and frankly, this whole discussion is going to be about that. And I think everything we talked about today, are generally worthy projects and important. And so you've just actually helped me put an exclamation point. And I'm happy that we're talking in the way of priorities, knowing that the number's going to be a number that we will have to live with. Representative Liebling, go ahead. You were going to say something else.
Yeah, so no, I was just going to ask you to perhaps repeat your question to me, because I don't think that was that wasn't your question.
Oh, no, I was just allowing you to react to the plan for tomorrow. You said it seemed reasonable, so that sounds good.
Yeah,
And
no, I do. I think that seems reasonable. There, you've got a number of items there, and I think it would be helpful to us if we can, and helpful to the staff if we can. Some of it isn't too specific about where in the bill or what exactly in the bill. So I think if to the degree that you confirm that up a little bit and send it out ahead of time, I think it would be
very good. And
helpful
so
to everyone.
just to the staff, these are, they're probably relatively, well, there's some numbers of pages. And so if between my CA and whomever, it would be the three main topics of the and I think that I'm not doing that with elderly waiver. It seems like we have some commonality there, and there's no one's asking the same kind of questions. No one's asking questions about the homemakers. Nobody's asking questions about the PCA. And so this just seems an area where there was just a lot of questions. And so the three nursing homes and the facilities, NEMT, and then the DWRS cluster. And then so if staff or whoever can provide what sections of the bill are there. And so I think what I would ask from staff tomorrow is that, well, first I want to hear from the people that are going to tell us their situation, and then we can just, we'll see how it makes sense. But then in brief, they could just describe the particular elements that the Senate has proposed to address those challenges in our way, which then you can, that's the productive part, I think. Anything else?
Chair,
oh, yeah,
Chair Pinto has
Representative Liebling. Yeah,
Chair
go ahead.
Pinto.
Oh, yeah.
Thank you. Yeah, thank you, Madam Chair and Mr. Chair. I just a reflection as you're talking. It's one of the reasons this committee has the nickname if people don't know this, of hell and human suffering, is that we have all of these really important needs put against one another. And as somebody who's particularly passionate about some of the areas, I want to make sure I'm not misunderstood, and colleagues too, in saying that there aren't massive needs across all these areas. And unfortunately, we get in a place where we pit one really important need against another really important need. And we're trying to measure tiny gradations of need when they're all needs. I guess I'll just make the observation that we're at a point where the tax bill has not been finalized. The target we've been given has not been finalized. And this is probably a chance for us to say, look, there's a massive need for nursing home funding and for DWRS and for childcare and for PCAs and for ending homelessness, probably more than there is, and I don't mean to be argumentative, but probably more than there is than some wealthy folks who may be getting tax cuts through how we might resolve a tax bill, for example. And so I guess I would urge all of us as members and members of the public, this is a chance for us to go to leadership and go to others and say, look, make sure we've heard the HHS first couple of days. Wow, there's a lot more needs than we even realized. So boy, we better make sure that we're meeting the folks who really have those needs rather than pitting all these areas against one another. We actually do have the resources to meet the state's needs. Because boy, I hate to be in a position of, as I say, of trying to figure out, is this incredibly needy person more worth than that incredibly needy person, when in fact we have the opportunity to meet these needs if we can just think about it more broadly. So I think we all can go out there and urge leadership and others to make sure we're given the resources in these decisions, because clearly the needs in this area are going to be greater than in some of those others. So anyway, thank you, Madam Chair.
Okay, thank you, Representative Pinto. So, so Senator Abler, so tomorrow you said Chair Utke is going to have the first part, and maybe Chair Utke could at least send out or ask staff to help send out which parts we'll be focusing on, and right, and then hopefully we can kind of conclude with some of these items that, because we're going to have to, I mean, I hate to say, but the House has a lot more, and there's a lot more we haven't talked about yet. And I realize, the gavel goes back and forth, and you, of course, can use the time to talk about what's in your bill. But
Absolutely. We do spend $1.7 million. So there is some pretty pricey items there. So never mind. Yeah. So we'll,
Right,
Chair
right.
Upke gave a thumbs up. He'll provide the list for you.
Okay, well, that's excellent. Okay. And then, and then we can, of course, we'll continue to communicate, and our staffs will continue to communicate and try to move the process forward as best we can, and hope that we can come up with another great HHS bill in record time.
Perfect.
So,
Good meeting.
yes,
Thank you. Thank you, Madam Chair.
thank you, everyone. So with that, then, it is 4 o'clock. Enjoy the rest of your evening.
Right on
We
time.
are adjourned.